Welcome and thank you for attending this meeting of the Adult Health and Social Care Policy Committee. The meeting today is open to the public and there are no items that contain exempt information. The meeting will be webcast and the recording will also be available for people to view later through the Council website. It is also possible that Sheffield Live TV will record and rebroadcast this meeting. Please can I request that mobile telephones and other such equipment are switched to silent mode so as not to disturb the conduct of the meeting. There is no fire test planned for today. If there is an emergency evacuation, please take instructions from the town hall staff. The assembly point is to the square. I will now ask committee members to introduce themselves and I will start on my left.
Good morning, everyone. Councillor McRooney. I represent Woodhouse Ward, and I've just turned my phone off as requested.
Good morning, Councillor Matt Dwyer. I represent Burley Ward.
Good morning, Councillor Laura McLean. I represent Walkley Ward, and I'm group spokesperson for this committee. Thank you.
Hello, Councillor Ruth Milsom. I represent Crooks and Crosspool Ward.
Councillor Dr Worsap-Pyle, Stannington Ward.
Councillor Steve Ayres, good morning, and I represent Graves Park Ward.
Councillor Terry Folks, Manic Castle Ward, also substitute member. Thank you.
Could I ask the officers to introduce themselves? I'll start here with Sherry.
Hello, I'm Sherry Grant. I'm Assistant Legal Services Director.
I am Alexis Chappell. I'm Strategic Director for Adult Care and Wellbeing.
I'm Rachel Marshall and I'm Principal Democratic Services Officer.
And we also have Alan who's helping us with all the tech. So thank you, Alan. Very important role there. Before I go on to the item 1 on the agenda, I would like just to take a few seconds to just acknowledge and pass our condolences to the family and friends and colleagues of Councillor Paul Wood, who passed away suddenly on Sunday. I believe this is the first official meeting that we have council. There will be several, I'm sure, occasions, but the flag is flying half-mast, and I'm sure people will stop and think, why is this happening? And it's for the next 4 days, I believe. Can we take just a minute to remember our time with Paul? Thank you. Item 1 on the agenda is apologies for absence. Apologies for absence have been received from Councillor Julie Gurkut and Councillor Terry Fox is substituting for her. So thank you very much for that, Terry. Item 2 on the agenda is exclusion of press and public. As previously said, there are no items on the agenda that contain exempt information. Item 3, declaration of interest. Are there any members that wish to declare an interest in any items on the agenda? Councillor Sipwell.
I'm not sure if this does constitute a conflict. However, the best man at my wedding, Dr. Dave Bishop, has just been appointed a consultant on the primary and community mental health service, which is a key part of item 11. So if Alexis could give me a steer as to whether or not I should exclude myself when we come to that, that would be greatly appreciated.
Right. I do apologise. It would be me actually, but I will just clarify with Alexis, what is the nature of the consultancy?
So the report provides an update on the activities that we're undertaking around delivery upon the all-age mental health strategy. It doesn't talk about operational delivery in the report, so
Yeah, there's no prejudicial interest. Yeah. Thank you, Alex, for that. Yeah, I mean, obviously there's no prejudicial interest, so there's no personal interest, but I think it's worth noting that on the minutes. But you are able to take part and vote. Okay.
Thank you, Councillor. Item 4 is minutes of previous meeting, and there are 2 sets of minutes. The reason for this is because the minutes for the March meetings were not attached to the pack last time, so we couldn't sign them off officially. So on page 11, you will see the minutes for the March the 20th meeting. So can I take that these are a correct record of the meeting for those of us who were there? And then what I will do, I will go through each page to see whether there are any matters arising. So is page 11. Councillor Sapwell.
I do believe that I was present at that meeting and I haven't been
March.
listed.
Okay, could we amend that, please? Thank you. Thanks, Councillor Sapwell. So page 12, 13, 14, 15, 16, and 17. So are we happy with those? There's no matter arising. I'm just initialing each page. Is that correct, Chair?
Yes, that's correct, Chair, and if you can sign the end, thank you. Councillor Watson.
I don't know why I hadn't seen it before, but I seem to be there twice on the 20th of March meeting. Still haven't developed that power.
Well, maybe we'll take one of your presents off, and thank you for spotting that. I hadn't. And today is the 18th.
Yeah, the 18th.
That's one set. And then we have on page 19 the minutes for the meeting that we held on the 19th of June. Can I take them as a correct record of that meeting? Have we got the right people? Only once? Yeah. I'll go through them by page. So we've got page 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, and 29. So I am officially initialing all of these for you, Rachel.
Thank you, Chair.
Switch off these initials and not signing every. My name is so long. Yeah. I remember that now. 24th.
Thank you very much.
Brilliant. Thank you. So, item. Whatever item is after. Sorry, I've just given you one of my papers, I believe. So, item 5 on the agenda pack is public question and petitions and statements. We have received none by the various deadlines And item 6, members' questions. Again, we have received none by the deadline. So we're going to move on to item 7, which is the work programme on page 31 of the agenda pack. Are there any questions, comments? I just noticed that there was a description missing on page 37 for one of the items on today's agenda. The description says to be confirmed for, I can't read it now because I have to use my magnifying glass. But yeah, one of the items doesn't have the description. Maybe we can adjust it for next time. It's a working document, so it will change all the time, but at least for this one, because it's going to be in the past, we can add it on. Yes, please.
Thank you, Chair. I can just confirm that if there is, you know, a missing description there at that request, we can get that updated.
And so the recommendations for this item are on page 32. We basically just ask the committee work programme as set out in Appendix 1 to be agreed, including any addition and amendments identified in paragraph 4 of the report and any agreed by members at the meeting. And that any referral from council and committee, petition and resolutions detailed in paragraph 2 of the report be noted and the proposed response is set out as agreed. Are we happy with those? Yeah, so I'll just say, I've got to say specific words now that I haven't been asked to say before. So all the recommendations are agreed unanimously, I have to say.
Yes,
and yeah,
resolved unanimously.
Yeah, just prod me if I forget to say that. And so we can go on to item 8, which is the first report on the agenda. And this is on page 41 of your pack. And I believe John is presenting this. John and Dawn, I have down. No, just John. Brilliant. So John, if you wouldn't mind introducing yourself for people who don't know who you are out there.
Hi everyone, John Chamberlain, I'm a Workforce Development Manager in the Adults Care and Wellbeing Service. So yeah, thank you for having me. Lovely, so just here today.
Sorry, can I just point out, for those officers that are speaking at today's meeting, welcome, and you should find a nameplate, your nameplate somewhere across there. If you do want to get it and just pop it over the edge, that's good for the public so that they can see. Thank you very much. Thank you, Chair.
Yeah, and John, before you start, again, I've got some meeting guidance that are new. So, for each of the substantive items on the agenda today, please, could I remind everyone of the process that we will follow? The officer will be invited to present their report to the committee. Members of the public that have had access to the reports in advance, so please assume that members have read the report and provide a high-level summary. This will be followed by questions from members to the officers. Once all the questions have been asked and responded provided, we will then move on to the discussion. After any discussion has taken place, the recommendation may be moved and seconded and taken to the vote. This will enable us to conduct the business of the meeting smoothly and efficiently. Thank you all for your cooperation.
Lovely, thank you all. So today I'm here to discuss the paper, which is the update to the Adults Care and Wellbeing Equality, Diversity, Inclusion and Social Justice Delivery Plan. So the EDI delivery plan, which I'll call it from now on, just to shorten slightly, was a paper that we brought to committee back in December 2023. The delivery plan was agreed by a committee back in December 2023, and the plan sets out how we aim to meet our statutory and regulatory requirements in relation to equality and anti-discriminatory practice in adult social care. That includes our public sector equality duties, some of the legislation around the Care Act and some of the legislations that as an adult service we're bound to. The report back in December was developed by taking learning from the SACMA Speak Up report and also learning from the Race Equality Commission report that the Council have undertaken work on, and also referenced some of the Sheffield State Council equality objectives as well. So that was some of the learning that we used to develop our adults plan. We also used industry standard best practice as well, which was Diverse by Design, which is a local government association methodology that we used to develop the plan as well. So just to say that. The EDI plan was framed against 5 priorities back in December, which is knowing our workforce and communities, partnership and accountability, practice learning and development, active and independent learning, and creating a safe and inclusive work environment. So that's how we framed the delivery plan, which was signed off in December 23, and we've included an updated delivery plan as part of this paper, which is under appendices 1. This paper forms part of our cycle assurance, which is on a 6-monthly update, just for committee to know progress against that plan and any actions that we were taking in relation to this. The plan sets out activities that we've completed since December, but then also what the priorities over the next 6 months will be in relation to equalities and adult social care as well. As I say, that's all included as part of appendices 1. So just wanted to give a kind of a very high level summary of some of the key activities that we've been undertaking as part of the plan over the past 6 months or so, and then we'll talk a little bit about what the priorities are moving forward for the next 6 months until the next update. So in terms of the high level activities, and again this is all kind of contained within the paper, just starting on with the work we've undertaken around the Skills for Care social care race equality standard. So the social care res, we'll call it from now on, it's been developed by Skills for Care. It's an industry-standard best practice in relation to equalities, and it's been used to identify issues and measures improvements in the workforce in relation to equality and diversity. The standard is used against 9 benchmarking standards, which basically help us to examine any disparities in relation to race equality in relation to the workforce as well. So the social care race equality standard is quite new, so it's only been developed over the past few years. It's something that the NHS have used quite widely, so members may be kind of aware of that, but in terms of social care, it's not been widely used in terms of this space. It was piloted in 2022 and 2023 by 11 local authorities and a further 43 last year. So this year, and as part of the original work development plan, Sheffield City Council have committed to take part in the social care race equality standard this year. So we're just in the process of completing that activity at the moment. As part of that, we'll join a community of practice across the country with other local authorities to support our kind of action planning and best practice in this space. And that we'll use that to support our ways of working, and the plan will be hopefully to identify any areas of inequality or any areas in social care where we may need to tackle in relation to equality, diversity and inclusion. So we'll be undertaking work as part of that. Just to note that it's a benchmark standard that's used across the country as well, so it's quite, for myself personally, it's quite a proud moment for the council actually that we're undertaking in this, and really highlights our commitment to tackling inequality and making sure that we are really doing all we can to be an equal and fair local authority. We'll use the findings from the social care race equality standard to inform the future iterations of this delivery plan. So the plan will be in 6 months' time. Hopefully we should have good analysis that we can bring to this, along with any actions that will follow from that. A summary of the activity relating to the social care race equality standard is included as part of appendices 2. So there's more information as part of that. The other key activity, just to flag, was in relation to our engagement with communities. So we've commissioned an organisation called SACMA to undertake some engagement activity in relation to care and support with underrepresented communities in Sheffield throughout 24-25. If members aren't aware, SACMA are an organisation that work predominantly with Black, South African and Caribbean communities in the cities, so that's their main kind of area in terms of this. So we're working closely with SACMA to look at developing our engagement and peer approach for the city. The ambition is to really embed culturally appropriate care across Sheffield in this sector. And also to look, with one of our ambitions is to develop a social care workforce that is really representative of the communities of Sheffield and make sure that people can access care that's appropriate for them as well. So just to note that we're undertaking work with SACMA in that space. In terms of our internal staff, we've been developing our approach to diversity champions for our internal workforce. So we want to ensure that all staff are treated equally, feel included, are valued. We're supporting their health and well-being, and also they have access to appropriate support where appropriate. So with that end, we've embedded equality, diversity, inclusion champions within adult social care in the council. We've developed appropriate routes for champions to share any feedback or any concerns that may be raised as part of the workforce. So really embedding that, the feedback loop with senior management, and hopefully that will help us to identify any concerns and develop improvements for our staff as well moving forward. Just to say that runs alongside work that we're taking part of in terms of the staff quality networks as well, which have been led by equality teams in the council as well, but obviously we're heavily involved in terms of that and promoting them with our staff as well, so really moving that forward. The delivery plan itself contains a lot more information in terms of a lot of work we're doing in terms of around the qualities, so in particular, just wanted to flag some of the excellent work that we've been doing in relation to kind of the priority around active independent living. So that includes the work undertaken as part of the safeguarding work, the advocacy hub that we've commissioned recently, the work to support direct payments, the complaints and concerns, the unpaid carers and families improvement programme, and the recommissioning activities that's been taken part of this. So obviously lots of activity in relation to that, and more details in the delivery plan as part of that. Just to note as well that Alexis, as part of her DAT update as well, will be setting out an anti-racist statement as well, which outline a kind of zero tolerance approach to racism in the city, and really defining how we're going to support our workforce to make sure that we're really not tolerating any kind of anti-discriminative practice in the city. So that Alexis will give a bit of an update in terms of that as part of her DAT update later in the agenda. Just to flag, so in terms of priorities for the next 6 months of 2024, so a lot of for the past 6 months, we've been focusing on our internal workforce and the support within the Adults Care and Wellbeing service, and looking at how we can really support our internal workforce. The plan moving forward will be looking at how we can support our external commission sector workforce in regards to equalities, and that will be using the Care Academy, which we'll be launching next month, and will be coming as part of our workforce development strategy in October, really using that as a tool for us to support the workforce moving forward in regards to the wider care sector. So just to give a kind of a high level kind of summary of some of the work that we've got planned in terms of that approach. So we'll be looking to develop sector-wide equalities champions with providers in the cities, also looking to support equalities networks with the kind of external care sector. Also looking at how we can promote role models and positive stories to really try and promote careers in care, and look at how we can support people to develop within their roles in the care sector. We'll also be working with partners to promote inclusivity events and forums and workshops to really kind of understand and get to the bottom of how we're supporting equalities in the city. We've also committed, and one of the notes of the recommendation is that in 2025 we'll organise a workshop specifically focused around equalities to involve and engage voluntary faith, community sector, care providers and academia as well. So we'll launch that in 2025. Also to note that we will be working with our care providers, again as part of the work as the Care Academy, to review their recruitment practices and develop our learning development offer, specifically around equalities and fairness. And lastly, just to say that we'll continue to engage and review our community engagement approach. Obviously we've talked about work with SACMA that we've done to engage with the Caribbean and South African and Black communities in Sheffield, but obviously we want to make sure that we're continuing that approach across other communities in Sheffield as well, and making sure that there are no barriers to accessing services, and making sure that we've got a fair offer in the city. That was a really high-level summary of the report and the delivery plan. Just to note the recommendations as part of the paper, which were to endorse progress made as part of the Equality, Diversity, Inclusion and Social Justice delivery plan. Number 2, which was to note support of SACMA to develop a community engagement and peer model to support implementation of culturally appropriate care within underrepresented communities. Number 3, which is to note our approach to engagement and equalities workshops, which are planned for 2025. Number 4, which notes progress made with regards to the social care race equality standard. And number 5, requests that further updates on the progress of this delivery plan are requested by Alexis in line with the cycle of assurance. And that's all for me.
Thank you. Before I take questions or comments, I just wanted to say something myself to chair privilege. I just want to say how grateful and proud I am of this work, because it's something that I championed from the very start, and Steve and George were very much part of us asking for, seriously looking at diversity and how we treated our staff, first of all, but also engaging with communities and stakeholders. And I think we've been one of the first to actually go out and bring other people and working within, although people from communities and community groups don't sit on the committee, there is a lot of work going in the background where we do engage and co-produce things genuinely with other organisations working in partnership. So I'm very, very grateful. One comment is that I think this is super important because it's about our staff and how we support, train, but it's also how we deliver services so that they are fit for different communities and different needs. But I wonder if there is anything very specific that supports our own employees from minoritized communities to rise through the ranks of the organizations, because we already have a situation where most people at the top do not represent the city. And I think we need to maybe be a bit more explicit and get rid of whatever hurdles people have to jump, because we know that it's much harder for people of colour or people who have any kind of protected characteristics to actually come through at the top of organisations like ours. So I wonder whether there are any plans to do that.
Yeah, it's a really good point, well made. Thank you, Angela. Yeah, absolutely. I think what we'll see is that as part of the Skills for Care, Social Care Race Equality Standard, what we'll do is we're already looking at analysing the data in terms of our recruitment activity and looking at how, if there are any barriers in relation to that, and it already looks as though we're seeing some trends in regards to that. So there'll be an action plan that will be developed as part of that analysis following that. So we'll bring that to committee next time, in 6 months' time. One of the suggestions that we'll put in place will be how we can support colleagues that were from protected characteristics, so things around supporting them with the kind of applications, around kind of mentorship programs, and with interview techniques, that kind of stuff, just so that we're supporting them along the process as well. So that's going to be likely one of the recommendations or one of the activities that we'll undertake as part of that. But I think it's important for us at this stage just to analyse the data and see exactly where the gaps are in regards to that. So, but absolutely, that's one of the things in particular we'll be looking at doing.
Thank you. I have Councillor Sapwell.
If I could take you to page 47, point 3223. We've got the abbreviation LGB+. Can we just make sure in this high-level document that we're inclusive of the trans community, please? And can we make sure that's consistent across all documents?
Yeah, absolutely. Apologies for that. That wasn't intentional.
It is, well, that's fine that we've cleared it up now. It's just that if we're going to have this as a high-level strategy, I think it's really important. And the second question I've got is this too high a level document to include certain pathways? Basically, I'd love to see something in here about the council strategy for end-of-life care, because there's huge disparities between the quality of end-of-life care given between different ethnic groups.
answer that as well? Because I think we do work on end of life under Compassionate Sheffield, but it comes under commissioning and public health. So, but I think maybe we can reference it so that it's more complete. Do you want to add something, Alex?
So it's a really good point about the support to people at the end of life, and I'm going to answer this in 3 different ways. On a very practical delivery level, there's many care workforce across the city that support people at the end of their life, and part of the work that we're doing around looking at culturally appropriate care, and particularly the learning from SACMA, is to look at how do we make sure that, particularly when our care workforce are supporting people at the end of life in their own home, or in care homes across the city, that we are absolutely thinking about the culturally appropriate mechanism to go and do that. So that's kind of the first element, and we'll pick that up absolutely through our operational delivery. And then the second element to that is around, there is the development of a South Yorkshire approach to end-of-life care, which has been led by colleagues across NHS South Yorkshire ICB, and that links into local work that we're doing, and particularly I've been a Compassionate Sheffield. And so what I could do is, because I'm part of that working group, I will raise that to colleagues within the working group to talk about is actually how do we make sure on a strategic basis we're also thinking about the support that people need across the wider NHS system as well. So I'll take that as an action from today.
I have Councillor Ellis and then Councillor Milson. Can I take both of yours and then, yeah.
Yeah, thanks, Jim. Mine was really a comment to endorse the point that Angela made earlier about progression routes for people with protected characteristics, and those people that tend to the voices are less heard, and it's an issue that it's not just social care, it's across the public sector. I think that it's something that is particularly dear to my heart, and I think that social care and adult social care can lead on this. I think it's very, very difficult when you're trying to recruit people that have the skills to senior positions, and it's a point that I tried to make going back to a couple of years ago, that we need to do what we can to look at ways of enticing people. I mean, we know that recruitment is an issue, in social care generally, but once you recruit people at basic level, then we don't have some sort of structure of progressing those people with those particular you mentioned protected characteristics and so on, through up to senior level and to managerial level and so on. So yeah, it's just to endorse the point that Angela was making, I think.
Councillor Milson.
Thank you, Chair. Thanks for the report. So much exciting stuff in it, and I'm really excited about the Care Academy, but we've got that next month, so I won't mention anything about that. But I just wanted to touch on the unpaid carers little section here, and obviously we're really committed as a whole team in adults to support unpaid carers as much as possible and to increase the offer for unpaid carers. So my question here really about equalities is whether the Sheffield Carers Centre is being equally accessed across ethnically and economically diverse groups.
I will admit I don't have the data on that at the moment, Councillor Milton, but I can take that up as a point of action. I'll come back to you directly if that's okay.
I have Councillor McLean and Councillor Dwyer. Could I take both and then?
Thank you. Yeah, thank you so much for this report. There's just so much good stuff in here. It's hard to know what to comment on, but I just wanted to highlight, it's just really good to see the commitment throughout this report to social care being a profession and care workers being professionals. That comes out all the way through really, but obviously there's a section on it as well. And just, I won't, like we said, I won't talk about the Care Academy because we're coming on to that next month, but it's just really exciting to see this commitment to sort of training and progression and and it helping the staff feel valued. And I know from speaking to care managers in Walkley, the ward I represent, that's what they want to see. They want to see people feeling valued and able to progress. And you know, it's good for our workforce. It's really good for those people who are in receipt of care, and it's just really good to see. And yeah, thank you very much.
Councillor Dwyer.
Yeah, thank you very much. So my question was about, and it might be for the DAS statement, but it was the zero tolerance approach to racism. It was sparked thoughts about obviously the riots in the summer and support to communities, particularly care workers who come from overseas. Some work I did in another city, we became very aware that most came from Nigeria or Kerala, and supporting them was going into those networks. And I was just wondering whether you had any data on those coming over on sponsorship visas, which countries of origin, and how best to support those care workers. And then also, I suppose, building on what the Chair and Councillor Harris said, also looking at progression, because often they come with an immense amount of experience and skill set that should mean they should be able to progress quite quickly in this profession.
Yeah, absolutely, would agree. I mean, what I would say is that I will pick up some specific points that you've made there as part of the workforce development strategy update next month. The work that we're doing to develop the Care Academy in Sheffield, that includes specifically some support around international workforce. And there's some particular projects that we're looking at, particularly how we can support our care providers and also people that have come across international recruits in terms of the care sector. There's some wider actions that we're picking up as part of the Care Academy around developing progression routes for care workers and looking at how people can progress and professionalise it in the sector. So I think some of this will be picked up in the October committee report. We do have the data on the international recruits, but I don't have it to hand, unfortunately. So again, I can reach out following this and give you a bit of an update on that if that would be useful. Yeah.
Brilliant. Thank you very much for that, John. Really in-depth kind of report. I will not re-say the recommendation that John very kindly read out himself. They are on page 42 of the pack. I will take silence as agreement. And I have to say the same, don't I? Are we all agreed that we're happy with all the recommendations? Brilliant. So the recommendations are agreed. Resolved unanimous. That's not what it says here, though. I'm reading from the paper I've been provided. Okay. So we're moving forward on to item 9 of the agenda. Thanks, John. I'm reading. Item 9 is on a separate, it's the supplementary pack. So if anybody needs a copy, there's some on the table over there. Thank you.
Okay, good morning. It's Andrew Drummond, Safeguarding Quality Assurance Manager. I'll hand over to Sid. Apologies, Sid and Adam haven't got a card, but I'll let them introduce themselves.
Hi, I'm Sid Fletcher. I'm Service Manager for Sheffield City Council for the Mental Health Acts, the Mental Capacity Acts, Deprivations of Liberty Safeguard, and also the Forensic Social Work team.
And I'm I'm the chair on the customer forum, which is part of the Sheffield Adult Safeguarding Partnership Board.
Okay, thanks Sid, thanks Adam. Okay, so today we've come to give an update on the Safeguarding Delivery Plan and bring our appendices for endorsement. So we've just come to, and we'd like to take you through the highlights of that and, and take any questions. So the first being looking at recording of practice and an update on the improvements we've made. So thinking where we've been to previous safeguarding boards and also to committee and where there's been points raised for good practice improvement and the work that we've done. There's been a period of work since the turn of the year looking at our safeguarding workflow in Liquid Logic, which hadn't been reviewed since Liquid Logic was implemented in 2018. the review's been thorough at every step. We've had frontline staff involved, we've had staff who are involved in our statutory reporting, and looking to see what we can include for best practice, what we can take from, for example, improvement from safeguarding adults reviews, domestic homicide reviews, and also where there's been conversations, as I say, at SASP board or committee in the past. So, for example, to take us through some of the changes around consent, we've been looking to see where we've got the adults' consent in audits over the past 12 months, but at times that's been difficult to pick out when it's just been free text within a document, whereas now we've specifically included a section to make sure we have included consent, and where we've not got consent as well, reminding staff that at times we do need to proceed where we've not got consent for the safety of the person or for other people. So yeah, creating that assurance around consent, around homelessness too, where we want to do more to make sure we're improving lives for people across the city, and making sure we are linking in. I know there's a question from the safeguarding board at one of the previous executive boards where they asked about in context to our duty to refer as a statutory organisation, and looking at our data on that issue and how we're performing. So we've included that to make sure that we are referring to housing solutions where we need to. And again as well, where there's been a focus on domestic abuse, self-neglect, modern slavery, making sure that we're adding the links to specific areas and government legislation when staff do select those categories of abuse, to create them assurances that we're having that consistent good practice in those areas. And that went live on Monday, as I say, after a lot of work going into that. So we're hoping to, as I say, see in future performance reports that we can see improvements in that and in future audits. So that's, yeah, point for, as I say, big achievement at the moment. From an organisational safeguarding point of view, again, there's been a lot of work going into this over the past 12 months plus, where there's been a pilot in our multi-agency safeguarding hub, and also in line with our care homes team, to try and bring us to an area, to bring us to a better place when it comes to organisational safeguarding. So that includes from a practice perspective, and also when it comes to the recording side. I've not mentioned in there as well working with commissioning, who've been a key partner in that. So making sure that we're sharing information at an early stage. So I say colleagues in operational teams and colleagues in commissioning have that information, can make a decision together as to whether a situation is organisational safeguarding, and making sure we've got a joint approach to managing that risk. And as part of that, certain changes again have been made to the system to make sure we are hearing early indicators of concern and taking necessary action. And the next step of that is spreading that knowledge and practice throughout the rest of the service. Next one is around the learning from safeguarding adults reviews and the continual improvement, shall we say, in that area. And since I've been in post alongside with Dawn Bassinder, my manager, where we hold a monthly meeting now with our service managers, our safeguarding practice forum, to look at SARS, look at DHRs, to make sure that their messages are being spread across operational teams and that learning is being taken into practice. Another point for good practice is around drug and alcohol related deaths across the city. The police get in touch with us now, and we have better information sharing with them. At times it may be that we've not known somebody, but where we have, sharing that good information with them so we can take that action learning across all partners. And finally, that last highlight as well is around preventing and responding to allegations where the source of harm has been a person in position of trust, and the funding we've got from the safeguarding board to appoint somebody specific to that area. We wanted to highlight and inform yourselves and the public about today. Within the report as well, it's a safeguarding and DOLS update. We've got Sid along today to take us through DOLS aspects. So I'll hand over to Sid if that's okay.
Thank you, Andrew. Morning, everybody. I'm pleased to report that the DOLS team are in a much better position than what we were last time I was sat in this room in front of these certain individuals. We've made a lot of progress with the improvement plan that we wrote at July last year, But I'd say that we're not out of the woods with dolls. We're getting through a lot more dolls assessments than we were doing this time last year, but we are still noticing an increased demand upon the team, upon the service to sort of complete dolls assessments. So we've written into our further improvement plan some more planning about getting more best interest assessors to undertake the work involved in depriving people of their liberty in care homes and in hospitals. Does everybody, I'm just assuming everybody understands what dolls are. Would you like me to make a very...
Yes, please, would you? Because
it's
webcast and people may not know what it means.
DOLS is an acronym for Deprivation of Liberty Safeguards, and it usually applies to the sort of residents who are in our care homes within the cities. And it usually applies to people who are over the age of 18. It applies to people who have got mental disorders or a disturbance of the mind, and they cannot properly make decisions for themselves, and their capacity is impaired. Therefore, we have to consider to deprive them of their liberty to keep them in the care homes or a hospital and keep them safe. So it authorises basically the deprivation. It authorises the staff to sort of not let people wander out into the streets or come to potential harm through misadventure. It's a different legislation to the Mental Health Act, which is about active treatment in a psychiatric hospital. This is much more about sort of protecting the sort of people who we look after in our care homes. We estimate the care home population of Sheffield is around 4,000 people, 4,000 individuals, and we estimate roughly that approximately 2/3 of those people don't have the capacity to consent being there. So basically they don't understand the reasons, they can't weigh up, they can't retain the information as to why they are being placed in that care home, stuff like that. And obviously being placed in the care home because of significant concerns about their abilities to manage their affairs and their abilities to manage their safety and manage themselves as well. So we're looking at around a population of around 2,600, 2,700 people in Sheffield that are potentially deprived of their liberty, and that puts them in breach of Article 5 of the European Court of Human Rights. That is the right not to be imprisoned. So we have to be mindful as an authority because we have to sign all that off. And then there's also another Article 8, which is the right to private family life as well. We have to be mindful of this. So there was major plans up till about last year to the mechanism to deprive people is the DOLS framework, and we're pretty much stuck with it. It's clunky, it's bureaucratic, there's lots of red tape. It's not the easiest bit of legislation to manage, but nevertheless, it's legal and we have to do it. There were plans to sort of replace it with something that was a bit more leaner and a bit more light touch, but they got thrown to the long grass last year, basically. And within the professional DOLS community, there's no indications, and from the legal sort of colleagues that support us, that it is going to change. We are sort of stuck with this legislation. So basically a year ago was tasked with a plan of how we get through all these thousands of people. So basically we home grew our own DOLS team. And we did a massive, over the past year, and that's what I need to report in, we've done a massive drive in recruitment. Within that service, there are two levels. There's sort of more senior staff who actually sign off the deprivations, and then it's actually the best interest assessors that go out there, the sort of social workers or nurses sometimes, or occupational therapists that go out to the care homes and actually make an assessment of the person, speak to all the people involved. They present the assessment to the senior supervisory body. It's actually the supervisory body that signs the assessment off. So there's two levels there. So we did a huge recruitment drive on the backdrop of investment last year, and we massively, pretty much tripled the sort of staffing capacity of our team to do that. And we are getting through the work, but there is an increased demand on the work. So that's, a lot of the risk within the work has reduced. We've reduced our high priority referrals. We've reduced them by 84%. We've reduced the waiting list down from 4 months to within a month to getting out to seeing people. We've also reduced the renewals, because these assessments, they can only be done every 12 months, so they do come round. People always talk about a backlog. I see it as a constant waiting list. You'll never fully get rid of this backlog. It's always a continual cycle of re-referrals, because they'll come round every 12 months. That's been reduced by 50% for the high priority stuff. And also for the medium priority work, we've reduced that by 73%. So we're actually managing to get work done. But, and there is a bit of a but, is we are facing an increased demand of around 15 to 20%. So, we've managed to increase the supervisory body staff from 1.5 staff to 4.2 staff, so that's tripled pretty much. We've also our own homegrown BIAs, best interest assessors. We've increased the total number then to 3.5, up to 9.6. So yet again, we've pretty much tripled staff, but it's still not enough to do that. We're wanting to undertake around 2,000 assessments a year. That is our master plan. With the staffing that we have, we can get about 1,200 done. I can't really make them work any harder than that. I don't want to make them work any harder because they are working extremely, extremely hard. But there is the capacity within the supervisory body to sign off more assessments. It's the lack of capacity in the best interest assessors that we're struggling. That's why we want to procure some more independent staff. We don't want to permanently recruit at this point in time. This increase in demand might be a blip because of the legislation not going through. So we might have had a bit of a surge in referrals and people thinking, better put the dolls assessment in, don't want to get in trouble. So we might have had a surge. I'd like to keep a bit of an idea on a bit of a check on the pulse of the referrals coming in over the next year or so and see if it's sustained rather than permanent recruitment at this point in time. So we're proposing that we use independent staff, which there are plenty of, and which previously a lot of this work was just done wholly by independent staff, which does come with its problems because you have little governance over independent workers because it's very ad hoc. But we can get them on the framework, and that's what we're wanting to do. So we're wanting an extra 800 assessments undertaken by this group of staff. And it's £300 an assessment, so it comes in at just under 250,000 a year, basically. But we're confident that we can do that. It also means that the quality of the independent staff is getting better as well, because it's a bit of a buyer's market out there. So we're quite confident the quality of the assessments will actually improve as well, and that will put us on par for approximately $2,000 assessments a year. Like I said, it doesn't take us out of the woods, but it puts us in a much, much more risk-healthy position. And I've put in the report, there's been various local authorities that have been taken to court. A couple of them are quite negligible, the amounts, but a couple of them are a little eye-watering, and it would only take a couple of them for us to get into deep water, I think, really, when we could have avoided it, essentially. So that's my ask. But essentially, yeah, the DOS plan is working, I would say. We're getting a lot more work done, but there's still there is a risk that we do want to sort of neutralise as best as we possibly can. I don't think I've got anything else to say. So
Thank you.
I'm open to take any questions.
Thanks. Are there any questions or comments? Councillor Sapwell.
Yeah. So you mentioned that you're expecting maybe the demand to drop off slightly. What of the ageing population? What mitigations have you put in place for that?
We've noticed a huge increase in the past year, and there's a couple of theories to that, and that I think the first and overarching one is that I think that lots of the care home community and lots of the dolls community sort of nationally were expecting last year the liberty protection safeguards to come in and take over the dolls. So I think everyone stuck their fingers in the ears a little bit and turned a blind eye to referrals not going and stuff like that. And we noticed a distinct surge from last summer, which is when it was made crystal clear that the liberty protection safeguards weren't going for it. And I think at that point, lots of care homes and lots of managing authorities went, we better put our referrals in. And I think that's why. So that might be the consistent level. And yeah, we are getting a more aged population. We're getting a more complex population as well. We've got people with all sorts of, the vast bulk of dolls work is people with dementia and possibly people with learning difficulties as well. But we're getting lots more brain injury people coming through. We're getting lots more people with sort of, much more complicated mental disorders, autistic spectrum disorder, personality disorder, schizophrenia, all that sort of stuff. We are getting more complex work through. So I'm reasonably confident it's going to be sustained, but I don't want to commit to permanent staffing at this point in the future. So.
Thank you. Councillor Fox.
Thanks, Chair. Mine's on the general report and recommended. Do you want me to ask it now or at a little? Okay. So just bear in mind, Chair, that in the 20 years I've been on this council, I've never sat on this committee or a scrutiny committee about that. So please excuse a little bit about my ignorance on this. But in the recommendations, it talks about the strategic plan. And I've read the report, but I've not seen who bears the brunt of the costs of endorsing that strategic plan. We talk about cross-party and just listening to cross-agencies, I should say. So I'm just wondering, just through that, bearing in mind an individual may appear either at the A&E, may appear to the police, may appear to the fire, or any statutory. Who then takes the lead? Where does the money, without trying to be coarse about this, actually start? Who becomes the lead agency? I've just heard, obviously, thank you for your time and your report about the statutory law in some places, but who then becomes the lead agency that then has to deal with that individual through? And bearing in mind, we've heard about the 4,000 in care homes. There's obviously a lot more in the community. So just reading in this, one of the recommendations is to endorse that. And I've not seen any costs. And bearing in mind, I think the overspend at the moment is about 500,000 out of that 1 million in the report as well. So I'm nervous about a later report that's going to come on about the finances within this scenario. So I'm just wondering how that works. If you could just briefly break that down to me, how that works, and who becomes the lead agency, and when then does it become, if you want, the council's statutory responsibility, and just follow that through. Thanks, Chair. Sorry for that ramble of a question, but just so I get a clarity of when we come to the recommendations. So.
Alexis.
So I'll come in and give a view here. So there's 2 or 3 separate things here within that. The local authority, as in Sheffield City Council, has a statutory responsibility to undertake adult safeguarding. And that's our responsibility. That is not the SAS responsibility. That is our responsibility. And equally, it's our responsibility to undertake deprivation of liberty standards. And equally, as set out, is there also repercussions if we don't do that as well. So that is our legal responsibility, and that has been set out financially within the committee report, and to deliver upon that. And in terms of CQC assurance, they will look directly at our performance in relation to safeguarding as well. So that's kind of the first point. In terms of the recommendation around the endorsing of the Sheffield Adult Safeguarding Board Strategic Plan, there's a statutory safeguarding, so Sheffield Adult Safeguarding Strategic Board is a statutory board that's set up under the Care Act. And what that means in practice is it's a multi-agency partnership which has a strategic plan to direct its activities. And that strategic plan has been collaboratively, developed by colleagues across the city, but also very much with the Customer Forum, which we've got colleagues here representing today. And in terms of the costs of the strategic plan, that is actually met by the board, because each partner within the strategic board actually contributes income to the strategic board. And the strategic plan itself will be taken forward by the partnership organisation. We have an independent chair who leads that and takes that forward. And certainly what we could do is after this, as I could give that clarity after this with kind of financial colleagues. But what we've got to bear in mind with the safeguarding delivery plan is that the safeguarding delivery plan for us is actually as how we are delivering upon our statutory duties, and we are making sure that we are achieving these, and that's what's been set out by my colleagues here today. But the recommendation to us in the strategic plan is us as a council setting how we will support and very much contribute towards the partnership approach to safeguarding within the city. And I don't know if colleagues want to come in.
Yeah, we're going to hand over to Adam in a minute as well to say what part of the Safeguarding Customer Forum had played in collaboratively producing the strategic plan. I was just going to add as well, one of the making safeguarding personal principles within the statutory guidance from the Care Act, there's 6 making safeguarding personal principles, and one of them is accountability. And when we do our mandatory training for staff, we talk about ourselves as a local authority having accountability. But as part of that as well, one of the things we can do is we can cause inquiries, and essentially that means we can give another organisation an action. So where it's appropriate, we do, for example, ask health, ask the police, ask other care providers to take actions. So other providers are playing their part, and again, one of those making safeguarding personal principles is partnership, and there's that requirement on them where they do need to play a part, where there's a role for them. They do need to support in giving us information where we need or completing their actions. And I'll just take us up. Go on, Adam. Sorry. Okay. So just to take us on when it comes to the strategic plan. As I say, I brought Adam with me today, who's on the Safeguarding Customer Forum. I was just going to discuss the part that the Customer Forum's played in this being a collaborative piece of work.
Thank you, Andrew. So, to answer your question in Council Fox, quite a lot of what we did is basically start with a blank piece of paper. Alexis and the board gives us the opportunity to go, right, what do we want from a customer's point of view? Let's turn the street plan on its head. And one of your questions was about accountability. That is actually embedded in the street plan itself. Because we thought, hang on, we've got multi-layers, including this committee, our strategic board, which customers actually do sit on, and we do actually challenge our colleagues on certain aspects of safeguarding, because we'll bring that back next month when we do the annual report, because a lot of it is around that. The street plan was done, right, let's think outside box. From a service user point of view, what do we want to see? And so on page 5, from paragraph 3 onwards, it tells you a bit more about the strategic plan and how we developed it. So a lot of it is making sure the customer's voice is heard. So a lot of it is not just about, we don't see it as tick box exercise. So what we'll do is we'll go through the strategic plan with colleagues like Andrew, Alexis and board. We'll make sure the plan is indeed to, and on top of that one, what we decided to do is launch the strategic plan this year at the Adult Safeguarding Awareness Week, which Sheffield is actually hosting. So hopefully, quite a few of you in this room might have got an invitation to it. It's good to see some of you at that event, just to prove that it's not just councillors, us lot in the Ivory Tavern in Hampton House doing all this. Like, it is actually a partnership, and a lot of it is few of the questions we do ask on the plan, and not what it's how can we make sure it is a partnership. We don't just ask questions for the sake of asking questions. A lot of forum will sit on multiple subcommittees of the board, and we do sit on the COI best practice group, and we sit on the DOLS group as well. So trying to put it from a service user, carers and care, and going on to the last item we asked about carers and things like that, there is actually a section in the plan around carers this year. So it's not just, because we all think the carer's voice sometimes is unheard of, but it's not the what I call the statutory carers, it's the unpaid carers, because a lot of them are looked after their family members. Well, and a lot of them could also be young carers as well. So it's working in partnership, not just with the adult board, but with our children's colleagues as well.
Thank you. I'm going to I think we still don't have an answer to Councillor Fox's question. I think what he means is whose money is that we're agreeing to? And I was going to ask the question of why the amount was not included in a recommendation 4, because normally we have the amount that we commit to spend in the recommendations. So recommendation 4 on page 2 of the supplementary is approve the best interest assessor commissioning strategy, but it doesn't have the amount. Is it because the money is not coming from the council? That's what I think the question was. Or is the money that we're committing to spend council money? Yeah.
Just on that, and just to add on, obviously the chair's put that more eloquently than I have. In the report, it talks about an 84% increase in referrals in the last few years. And on the financial and commercial implications on the back. We're already talking about a possible overspend of over £500,000. That there's no cash to that in the plan as well. And as the chair has more eloquently put it than I have, I would have expected to see some sort of figures with that. Thanks, Chair.
So I think there is 3 different things that get talked about within here in the context of this report. The first one is in terms of the adult safeguarding. As I said, that's a statutory on the local authority, and I'll ask legal colleagues to confirm that afterwards to members of the committee. I think, and that's what basically the overspend is relating to, is actually the staffing budget for to undertake statutory safeguarding duties. And that has been, as it's noted in the report, is actually subject to business planning for next year as well. So to address actually what is an 84% increase in safeguarding for the city. The second point is in relation to the best interest assessor. Again, as Sid has highlighted earlier, that is a statutory duty on the local authority. And actually, what is the commissioning strategy? And I think that's maybe something about the legal recommendations here, is actually normally we put in legal recommendations is actually what's the amount in the commissioning strategy. But we have a new format, so I think there's been glitches. So I think within that, but ultimately that value is actually is an invest to save, because ultimately we have to undertake the best interest assessments. That's a strategy on the local authority. And actually, if we do not if the approval for the commissioning strategy is not approved today, then ultimately that will be a cost incurred to agency staff that we will have to undertake that staff. So that's probably the second point. The third point in terms of the strategic plan is a completely separate matter. The strategic plan is a matter for the Sheffield Adult Safeguarding Board, and that is the board's responsibility to implement the strategic plan. It is not of the local authority. We are a partner of the board. And in terms of the finances to do with the strategic plan, that's for a matter of the board to implement the plan and have the finances to implement the plan. So that's not a matter for the local authority. We are a contributory partner, but we are not the responsibility to implement fully the plan. Does that make sense?
It does, but there may be recommendations from that board, and us being statutorily responsible puts extra pressure or extra money into us and not via the NHS or other partner agencies. That's where I'm just wondering where the accountability is on that.
So I think what has been noted in the report is that if there was to be any implications of that financially upon adult care or the local authority, that would be brought back as a separate report for approval. Yeah. So at this point in time for this committee report, so that's why these finances have not been put within this committee report, is because ultimately at this point in time we have no financial responsibilities being put towards us as part of implementing the strategic plan. So basically at this point in time the endorsement is only for the strategic plan, and if there is an asking of the local authority as part of that, then obviously they would need to then bring that back to committee for approval at that point in time, but with a costed and funded area around it. If that makes sense?
Councillor Rooney, quickly, please.
Oh, thank you very much. You mentioned a waiting list, and then you used another expression that sort of made it sound slightly better. What was that expression you used?
Now I'm going back now. That was 20 minutes ago. I've probably forgot.
But my question is actually, while people are on that waiting list,
it's like a continual cycle.
Yeah.
It's a continual.
While people are waiting for that assessment, what measures are in place to keep them safe while they're waiting for their assessment? Not only them, but those around them and their families, because they could potentially be a risk to not only themselves but the wider community, and I'm not clear how we keep them safe while they're waiting to be assessed for presumably their liberty to be taken away from them.
Well, thank you, Councillor Fox. They're actually already in a place. Sorry, Rooney. Sorry. Capital offence there. I'm sorry. Yeah, sorry. The population of people we're talking about are already in a care home setting. They're not waiting in the community for an assessment to go into place. I think you might be thinking more along the lines of the Mental Health Act, which is my other baby, so to speak. But I'm talking specifically like people who are already in a care home setting who are essentially deprived of their liberty illegally. you know. So they've already got a care plan. Their needs will have been assessed. It's just that the local authority, as Alexis, and sort of answering Councillor Fox's sort of query, the local authority is incumbent on the local authority to go and make that deprivation legal and legitimate. You know, so we're talking about a population of people who have always been there. Don't get me wrong. That's why the dolls you know, legislation is quite cumbersome with that. So we're talking about people that are not waiting out in the community, putting other people potentially at risk. We're talking about people who are already in a care setting, but illegally deprived. Yeah, that's absolutely fine. I'm more than happy to, you know, a TED talk on that sort of stuff if that would be helpful. But obviously, the mental health act is my other thing, but we're not actually talking about that at this point in time.
And that's, but also with that as well, Councillor Rooney, this is where quite a lot of the fun actually does come in as well, because we can hold Sid and Andrew and colleagues to account on, because that's where some of the four members will sit on that one, and as a partner, we will look at the data as well, and what we can do as part of that one is, if we don't think we're happy with the thing, then we'll take it either through the mental capacity group, or we'll put a question into the CG board for clarification. So, just putting on that one, this is in the part of the accountability structure, what the forum does as well.
Thank you. I have Councillor Milson and Councillor Thornton. Can I take both questions and then I'll have to close this because we've gone on for quite a long time.
Thank you, Chair. I did just want to look at the this 84% increase in safeguarding referrals. I don't want to open the whole subject now, obviously, but just that is quite a large number, and it is there in the report and without much context around it. Well, without any context around it, to be honest, about the underlying reasons for that increase and whether there are any trends behind that. Is it safe to assume that examining underlying reasons for that increase sits with the Monitoring Advisory Board and will be scrutinised there?
Thank you, Chair. Apologies for my lateness due to traffic this morning. For the purposes of the webcast, I'm Councillor Sophie Thornton, Deputy Chair of the Policy Committee, and Councillor Fabici from Greenall. My question, very quickly, is around Liquid Logic, as I'm taken back to visits to services that myself, Councillor Milson, and Councillor Agenzia did, and that was something that staff in particular are finding relatively frustrating. It is very welcome to see positive report mentions of Liquid Logic within the report, but I'm just wanting to get an update on how staff are finding it, particularly with its integration into other systems as well. How is progress on that going, and are staff reporting better outcomes really with that?
Okay, so if I take the first one first, so in regards to that 84% increase, I think that's from a range of reasons. So, for example, whether it's training that we've been providing to staff and making sure that staff are putting concerns into our actual safeguarding workflow where necessary, and making sure that, for example, maybe what's happened on occasions in the past, where what they might have done to screen something out might have been documented in what we call a contact record in Liquid Logic. And I think practice has improved around bringing things into the safeguarding, what we call safeguarding workflow, and doing our information gathering, our evidence collecting in that stage, and coming out of safeguarding if we need to. So some things that come into safeguarding don't necessarily then lead into a Section 42 inquiry. So I think that's one of the reasons we see the increase. I think one of the reasons is, for example, with the MASH, we've got better relationships with partners. And I think in some ways, conversely, that's created an increase as well. And we've tried in recognising that. I know early in the year, in March, we brought a document around responsibilities for partners. So, for example, when a partner does refer into the multi-agency safeguarding hub and something isn't necessarily safeguarding, but they might have, for example, it would have been more appropriate to ask for a Care Act assessment or link them to another organisation. Then we send that document as well to them to try and support them and make them aware of other training that's available, so they have further knowledge on adult safeguarding. In regards to around Liquid Logic, was it specifically in context to safeguarding or just a general?
No, it was a mental health. I think this is a separate thing.
fair enough. Happy to withdraw the question if it's not necessarily pertinent.
I'll add, one of the things that we have done in recent times, where we've made these changes, we've had a number of briefing sessions, and one of the things that I've developed before we launched this, in the past at times we had liquid logic guidance for staff, which was, for example, telling them how to navigate a form from a point of view of literally what button to press, whereas before we've launched this, I've developed quite a thorough guidance which combines practice and the system. So when they're in a part of the form, it's not just telling them which button to press, but what practice considerations they've got to make as well. And there is parts where the form opens up and it's intuitive to, as I said in that example before, we may not be, after our initial information gathering, we might not be having an inquiry and the form would be smaller. Whereas now, if somebody is having if there's a section 42 inquiry required, we go more thorough, there's more questions and there's that more assurances for us as an organisation.
One as well, Bruce, quite a lot of it could be down to some of that little work we've done as a partnership as well. So some of it could be some of our work projects we link in with. They might have now got the ability and confidence to raise them safeguarding alerts to the Angela's team and them lot. So again, a lot of it could be down to communication and actually having the skill set to realise that, oh, that could be a safeguarding one. If we don't put it in, and so it happens, you can get further to 6.2 inquiry and all that lot. So a lot of it could be around actual late training and our communication as a partnership.
I'm going to bring this to a close. I just want to, Alexis wants to come in. Just before that, just for clarity for people who don't know, Liquid Logic is our database kind of software that is used for most of adult social care services. So it's just people don't really know what it is necessarily. Alexis, do you quickly want to come in and then we'll go to the recommendation?
So just in terms of 84%, it's a really good question about the increased demand. So in the performance report, which is included as an appendix, that does give some data around actually the increases, but actually also gives information about the performance of kind of adult care in relation to safeguarding. But when we look at the issues around the increases in safeguarding, that 84% is over the last 5 years. What that really relates to is 2 or 3 big things. It's number one is greater awareness of actually what safeguarding is, and because of the practice improvements that we've made, particularly across internally and across the city. And I see that as a strength, because actually people are now a bit clearer, and that was also as an ask of policy members previously towards us. So that is a strength, and that's a good way forward. The second key reason, though, we have an increase in demand is also a part of the reflection of post-pandemic, is the implication of the cost of living, the implication of actually more of increasing vulnerability, and actually of a frailer and aged population. So actually, when you look at the figures, what it talks about is actually we've got people within care home settings and in community, and that's kind of where the increase in demand are. So we've got to look at that as actually part of the post-pandemic that we're seeing across the piece. But secondly, third is actually also what we see is the referrals also increase from colleagues in the police, ambulance services and also residential care. Now, as part of the improvement actions that we are taking in relation to that, part of that has been looking at how we record and streamline our information through our electronic system, which is part of the work that Andrew talked about. But also, secondly, is over the next couple of months, what we're also looking at is how we make more efficient our referral systems and internal processes, because part of this is about efficiencies and ways of working. So that's part of the work that we're doing as an internal improvement sets of actions. But third is also working with partners. Because in March, as Adam said, what we talked about earlier on in March was a rights and responsibilities guidance for all partners in the city. And as part of my strategies, and actually the safeguarding board that we talked about earlier on, was actually on Friday, what I'll be talking about is actually how that guidance will be implemented across the city, including me as a DAS, right into all partners in the city, and what that means in practice. Because that's about recognising safeguarding as everybody's responsibility. It's not just the responsibility of the local authority. So that's kind of one part of that. But the other key part of that is also working with partners who have increased their referrals to us to look at, is there different ways through things like with adult MASH that we can actually prevent referrals and actually prevent abuse and harm in the very first place? Because for me, you know, when I think about it, what do I want our officers to do? What I want officers to do is be preventing people from being in vulnerable situations in the very first place. So part of the ways and the changes in which we are working is to get very, very, very much focused on that early indicators of concern, the prevention work, so that ultimately what we should start to see is that figure starting to reduce down, but actually start to see very much the improved outcomes for people in an earlier stage. And these things, you have to see these collectively together. What I have instructed my officers to go and do, though, is to be clear about the deep dive analysis of the 84%, because that's the work that we've been on and working at through the partnership board and with partners, but also to provide that dedicated briefing to members around the responsibilities around safeguarding, thinking about the conversations earlier on, the responsibilities of the safeguarding board, and also the deficiencies and the different ways of working that we're doing around safeguarding in the future. Does that make sense?
Thank you. I'm going to draw your attention to the recommendations that are on page 2 of the supplementary pack. There are 5 recommendations. The first one is to endorse the progress made with implementing the Adult Care and Wellbeing Safeguarding Delivery Plan, including actions identified from a self-evaluation carried out for the SASP board. And just to reference back what Alexis says, we have a meeting on Friday afternoon, a 3-hour meeting. I sit on the board as well, so some of this is on the agenda for Friday. Endorse the Sheffield Adult Safeguarding Board Strategic Plan, which is a plan that belongs to the Adult Safeguarding Board, and we are part of the partnership. Approve the early indicators of concern guidance, approve the best interest assessor commissioning strategy, and agree that an update is provided in 6 months as the performance and progress made in implementation of the Safeguarding Delivery Plan. Are we agreed on these recommendations? Where's the wording, Rachel? So I take that as agreement, and the recommendations are resolved unanimously. Are you happy now? Okay, brilliant. And we move on to item 11, which is on page 79 of the main pack. Thank you so much. Thank you, particularly Adam, for coming and joining us. Sorry, I mean 10. That is on page 79. Rebecca and Alexis are presenting on this. We're running a bit behind, so if we can have a very concise report without missing anything out. Just
So thank you very much for the opportunity today. I'm going to say a couple of words and I'm going to hand over to Rebecca, who's going to go into the details. So first of all, I want to start this by actually saying a very much a thank you to all of our care workforce across the city. And that is actually the 17,500 of a workforce that we have across the city. And I think I want to start off with that. And all of our workforce are absolutely valued. They work 24/7 every single day to support people in the most vulnerable parts of our communities and also the most vulnerable people across the city. And, you know, over the next few months, we've got some key things that's going to happen, which you'll hear about in the next committee, to go and support and value our workforce. And that is launching our very first ever Care Academy, our very first ever Care Awards, which will be in February 2025, and also delivering upon our workforce strategy, which the members, which committee approved last year. And actually to go to the next stage of that, of refreshing the strategy, is that how we take forward actually many things that was talked about earlier on today. But as was heard earlier on in the update by John around our equality and diversity plan, is actually we want to very much champion diversity and our ways of working with partners across the city. And that is because we want to become anti-racist in our approach, but also be very much disability friendly in our approach. And I say that because actually it's a very large care workforce who are made up of a diverse population that makes up Sheffield. And I have a workforce that I often hear where they experience many things in the city's care workforce. And so to me, I'm a great believer in if you value the workforce, you will get the best quality care. And so for me, and actually in valuing our diverse workforce across the city, what I want to do is, what we're going to do is take forward some key practical actions. Is number one is work to the race equality standard, because we want to very much value our diverse workforce. And secondly, very much embedding opportunities for professional development, such as the Moving Up programme, so people can move to leadership positions. And I started off as a home carer myself at age 17 and a half, so actually ended up as a director. And I would want that for absolutely anybody who, no matter where they start off in, in the city. That's really important. But actually for me, it's also being clear about setting a standard and expectation across the sector that we will not accept discrimination, harassment or abuse of actually any of our 17,500 workforce, because in recent events, some of our workforce did experience that. And actually, for me, it's really important that I stand up as DAS and say, actually, that's not acceptable. So for me, one of my key priorities is to set that standard and work with partners across the sector to go and do that. And to be really clear that actually as a collective care workforce, that's what we're going to do and work together. And actually, I have got a board that's coming up in a couple of weeks from now to very much work with partners across the sector so that we could collectively stand up and say, we value our workforce, we value our diverse workforce, and we will collectively stand against any harassment or discrimination that comes to do that. And I think that's quite a powerful thing to go and do, and for people to hear who hear this webcast very much in what we do. And so for me, I just want to say that bit about investing in our workforce, supporting our workforce, and taking that approach means that ultimately for all the people across the city, and we have around 50,000 contacts a year to adult care, we support around 16,000 people all in all on a long-term basis. And actually, we are one of the biggest providers in the city. We're actually as big as STH, I'm just going to say this, actually, and actually as a collective workforce. And one of the things for me is actually we affect a lot of people's lives every single day. And so it's really important that we get it right, and we get it right through our workforce. So that to me is the kind of standpoint I'm kind of taking today. And I'm going to hand over to Rebecca, who's going to talk about the performance and the order.
Yes, I'm just going to take you through the main highlights of the report. This is the DAS strategy development and performance update, and this one's focused very much on our preparation for CQC, highlights of the last quarter and current strategic developments, and our quarterly update on performance. In terms of programme delivery, within Safe and Well, we have our new quality assurance process for adults with a disability, and we've refreshed our joint health and care quality assurance framework for residential care. Alongside that, we're continuing to implement a system-wide discharge model outlined to committee in June, alongside winter planning, as we're sort of coming into that phase now. Aspire and Achieve and Connected and Engaged, we have a cross-sector working group which we've established to co-design a series of events and workshops for Disability City. We've also had, in the last month, peer challenges which we've invited in for people with learning disability services and mental health services. That's included engagement with people who use our services and their families and carers, and we've kind of invited that scrutiny very much to ensure we continue to develop an integrated provision that works for everybody in Sheffield, for individuals and communities. So there'll be further updates on that, working through the outcomes of those. Active and Independent, we transitioned to our new Care and Wellbeing service on the 3rd of June, as reported to committee, and we're continuing to embed that to help improve and provide flexible care, again, based on individual needs and on a community basis. And we're developing our approaches to waiting well, so that people can remain independent in the home as long as possible. And then under Efficient and Effective, we've outlined the challenges around recruitment and retention in this committee and previous committees, but we're continuing to embed and develop our workforce strategy on a system-wide basis for adult health and social care. In terms of partnership and collaboration, there are a number of updates that are going to come to committee in October. So the October committee, there'll be an update on the Adult Partnership Board, the adult strategy and delivery plan, and the market sustainability and providing support plan. And then to provide capacity for delivery operationally and strategically in the leadership for adult care and wellbeing in the city. We're currently recruiting to 2 director posts, one for operations and another director for quality, strategy, delivery and partnerships. That's really to give that leadership and that context. And Alexis has said it's a big workforce, so it's to make sure we can continue to drive through improvements. In terms of the update from ADAS, there was a response from ADAS following the summer disorder, which we've talked about a little bit, in terms of sharing practice and learning across adult health and social care and the impact on staff. And as I already mentioned, at a local level, we developed staff resources and support and the activation of the diversity champions across each service area within adult care and wellbeing. In July, Dr. Penny Dash from the Department of Health and Social Care started to look at the CQC and has highlighted a number of areas of improvement for the Care Quality Commission, including looking at their capacity to undertake their core functions. So there have been big delays in their ability to register regulated provision and review that, which has a big impact in terms of the market and available provision, the leadership and experience of staff, and whether the new assessment framework they're using now for adult social care, integrated care boards and registered provision, whether that's fit for purpose. So a lot of work to happen, a lot of improvements that need to happen with CQC, but at this stage they're not making any changes to their programme, so they're still continuing with their assessments of adult social care, which means we're continuing with our preparations as we have been. So in terms of our CQC preparation, quickly, try not to speak too quickly, we are finalising our self-assessment following the consultation committee. I remember we didn't have to consult on our self-assessment, but we felt that was really important as part of our accountability and transparency, and making sure we really did have a narrative that reflected the people who experience our services and our workforce on the ground. That will come back to committee in October for the sort of final sign-off. It's a little bit like Fourth Bridge, it never quite ends, because wherever we're waiting for CQC to come in, we have to update the data and things, but by October we'll have a document that we're pretty confident on the shelf, ready to go when CQC contact us. Same with the local area information return, which we have to provide when CQC send us the notification. That's in its final stages, alongside developing resources to support staff and prepare staff for the CQC assessment when it comes. As part of that preparation, we've also invited a peer challenge from the LGA in December of the whole of adult care and wellbeing, and that follows on from the peer challenge we had from ADAS in January 2023. So that will be basically a dress rehearsal really, and a testing of our self-assessment and our preparations for CQC. In terms of performance, just to run through some of the highlights, overall positive trajectory, and where we have challenges or where we've maybe not made the improvements we wanted to make, we have a clear understanding of why that is and robust measures in place to monitor and address that. So we have a further increase in the percentage of safeguarding contacts screened in 1 working day, currently at 64% compared to 54% in June and 45% in May. Continued reduction in DOLs awaiting allocation, which Sid mentioned, so I'll not go into that one. Slight decrease in long-term support reviews, so currently at 71% compared to 73% in June, which we're monitoring, particularly as we come into the winter, when we know that demand is likely to increase. Waits for home care have decreased to 54 compared to 68 in June, and likewise a decrease in occupational therapy assessment waits, so currently at 916 compared to 978 in June.
Thank you for that. Are there any questions, comments? Okay, can we go to the, thank you very much. I mean, it's incredible to see everything in one report. And I know that we give the highlights and the challenge, and this is on the backdrop of the, the increased kind of demand that we face all the time, isn't it? So it's incredible what gets done. So thank you very much, and I add mine and other members' thanks to our workforce, I'm sure. So the recommendations are on page 80, and they are as follows. There are 4. Endorse progress in delivering upon the adult care strategy, living the life you want to live. and notes the realignment of the adult care change programme around outcomes in the strategy. Notes performance update and notes follow-up reports will be provided to committee, setting out details of actions to deliver our respective standards. Number 3, note adult care structure set out at Appendix 1, and request that the Strategic Director of Adult Care and Wellbeing continues to bring an update to committee on our performance and delivery upon the strategy. I assume that is going to be in a year, or are we saying 6 months, because it doesn't say? Yeah, so could we add that to the work programme, just as a reminder? It'll be part of the DAS report, but it's just as a reminder so we don't forget. Are members happy with the recommendations? I'll take that as assent, and I will say the recommendations are resolved unanimously. And we can go on to, thank you so much, Rebecca, for the report and the presentation. And we go on to item 11, which is on page 95 of the pack. And I have Avi and Amy presenting. Thank you.
Morning, Council members. We're here to provide an update on the all-age mental health strategy. My name is Avi. I'm the strategic service manager for commissioning for mental health.
Morning, I'm Amy Budry. I'm head of commissioning for children and family. Apologies. Morning, I'm Amy Budry. I'm head of commissioning for children and families here at the council.
Apologies from our colleagues in public health and our health colleagues who weren't able to be here to co-present with us today. So, this is really an update. As you can see, our strategy has some key points here. It has some themes, and the appendices is probably really where we can show what we've been delivering and what we intend to deliver. The themes, I mean, I'm not going to go through all of them here, but I'm conscious that we're a bit short on time here, so I'm trying to kind of gauge that here. But we've got key themes around co-production, partnership, about all-age approach, about really making mental health everyone's responsibility and growing our network throughout the different areas. And it's very important for us to work in a trauma-informed way. The different themes in the appendices really outline what we've been doing here. The different interactions we've had with the various services on this matter beyond our own mental health, social care, public health potentially, reaching out into words like DWP, transport to an extent, and really looking at forming partnerships such as there's one on there at the moment around employment, where we're combining the ICB and the Safety Yorkshire Mayoral Authority, going in as a joint bid for an exciting new programme there. I'm not sure how much detail you'd like to cover. I didn't know if there was more. I'd leave more time for questions really around on this matter.
Councillor Sapwell.
I'm sorry, Chair, it's always me, isn't it? So I just think it's more of a comment from the Lib Dem councillors here, is that we just, after Councillor Thornton's timely intervention at the Health Scrutiny Committee, we do expect an improvement in neurodiversity assessments and the timeliness of them. So if that could be a major stream of work, that would be greatly appreciated.
Councillor Wilson. Milson.
So I didn't quite understand what Councillor Sapwell was asking for.
Neither did I, actually.
It's just that we've obviously got we're approving the oversight for themes 1, 3 and 4, including autism in that delivery group, and it would just be good to see a real focus put on encouraging especially Sheffield Health and Social Care Trust to improve their output when it's coming to the neurodiversity assessments, because as pointed out by Councillor Fortin at the last Health Scrutiny Committee, a lot of work is needed there.
Yeah, absolutely. We'll take that on board. I mean, there's definitely things happening in that area that's probably not noted in this report. So I myself come from a learning disabilities autism background, and I've moved into the mental health commissioning. And it's a real focus enabling discharge for individuals who are perceived as complex, who have been on mental health wards for a number of years. And we're doing some really good direct focus work on bespoke solutions there, as well as looking at, I guess, the approach on mental health wards and in mental health community services around autism, learning disabilities, but also around diversity. And well, the real diverse community that we have in Sheffield. So that is it's a real focus and a passion of mine, I would say, personally.
Councillor Nelson.
Thank you, Chair. Thanks for the report. Speaking as Chair of the Health Scrutiny Subcommittee, I'm sure Councillor Sackwell, you must be aware of the work that we've opened through that committee, and that it is intended to be quite a deep dive into the autism pathway and ADHD pathway. So that is ongoing and very much in scope to look quite deeply at that. Also, speaking as chair of that subcommittee, I really welcome the recommendation that the theme 4 under this work should be updated to the Health Scrutiny Committee regularly. And also, I just wanted to suggest that some of the actions sitting under theme 3, as laid out on page 109 onwards, would also be potentially of interest to the Health Scrutiny Subcommittee. So some health actions there. Basically anything in the actions with a health tag, we would be very interested in monitoring ongoing and receiving reports on those, particularly in terms of transformation within primary care settings, which, if they're significant transformations, ought to come to scrutiny anyway. But if they're more minor, we'd still be interested in looking at those. So if that could be noted, that'd be really good. And could I just ask a question about what is, just for a little bit more detail about what's happening in terms of training for a trauma-informed approach? It's something that keeps popping up as just a little sentence in various reports, and really interested to know what's actually, what plan sits behind that. And just to say, I think this whole area is one where, personally, I have rather more hope since there's been a Labour government incoming, because there's been so much said about the imperatives around parity of esteem for mental health and treating people with fairness and equity in the health system. And some of the work that is promised by this government, I think, is genuinely hope-giving to us. So hopefully we're on a better footing than we were a few months ago.
One can always hope. I'll take Councillor McLean, and I think Alexei and Avi both want to.
Thank you, I'll be quick. I just wanted to, there's a very specific question about, on paragraph 2.10 on page 99 about the conference that's being planned. Just wondered about a little bit more information, what that's going to look like. And also just to say, the report in general was just a really lovely read. I really appreciated in Appendix 1 about how you peppered that with the case studies throughout. And I just wanted to say it was a joy to read it. And it really helped highlight, how important this strategy is and the work that's going on at the moment. So just thank you so much.
Avi, do you want?
So I'll just come in first around the trauma-informed care. There's a lot of different aspects of this work that I think we're looking at. One is, I guess, looking at the direct interventions and being more meaningful and more informed in the approaches there. But that extends beyond. So if we're looking at the prevention approach, really, we're looking at social care, we're looking at social care practitioners, we're looking at health practitioners, we're looking at support providers, all being really informed about how trauma impacts individuals, how it impacts decision making, how PTSD and prevalence of that within multiple disadvantages, so people with difficulties around drinking, potentially, substance misuse, and the interaction of that. I think the Changing Futures is a really good example of that, of how we've looked at a real holistic approach, which married around it health provision as well as social care provision, and an approach of looking at how trauma influenced the individuals in this program, and how better outcomes could be achieved with that in mind. There's some very specific things like EDMR therapy, for instance, which is rapid eye movement therapy, which is for individuals who may not engage as much in talking therapies, and that being offered on a specialist at a specialist level. So there's different aspects for, I guess, the different levels, but we want the whole system to be really trauma informed, and it's a work in progress as I think research develops around that, and as we develop our own approaches and knowledge around that, it's definitely of high importance.
Yes.
Sorry, thank you for that. I really just want to comment that, there was a really upsetting piece of casework in my ward with a resident who was waiting on an 18-month wait for PTSD complex therapy, and at the same time had several medical investigations that were needed, and they were all on waiting lists. And I just want to, I want to put that, a lot of these case studies are really great, but I do want to put that on the table as an example of where something was going so badly wrong for someone's life. And what I would really love to see is what's promised in the report, that the health and care and all parts of the system, whoever you see at whichever front door you go in, will take that kind of person really seriously and escalate before they end up in a desperate situation, and as this person expressed to me, feeling suicidal. And I really don't want to see that happening. So we really have to get all agencies working together on this kind of thing.
Thank you. I'll bring Alexis in on that.
So just to say, thank you very much for the question. I think just to give a response and build upon a couple of things that Avi said, is that what we've got really in the city is a good partnership between colleagues across the city, across health and care and the voluntary sector, and across care providers. And that's always my starting point. And actually was the kind of questions I asked earlier on about the safeguarding partnership, because actually what's core to getting improved outcomes for people, but actually delivering that within best value, is actually the partnership and the collaboration across the city. And what we have undertaken is 2 or 3 things here, is in terms of the support to autistic people, but also the looking at how we do things differently. I actually chair the Autism Partnership Board, which is aligned to the Mental Health Delivery Board. And one of the key things that we're doing is very much looking at the waiting list, but actually different ways of working. But also from that is actually how can we support people post-diagnosis as well, because sometimes that's one of the most critical points for people in their lives. So very much that's a key feature and focus. Alongside that, the focus on trauma-informed care has been a real key priority, both actually in terms of Mental Health Partnership Board, but also in terms of safeguarding. And if I just draw a bit of a connection here, is that within adult care, we've made a priority that all staff actually undertake trauma-informed practice training. And actually, Andrew Drummond, who was up earlier on, actually leads on that implementation. It's something we took quite seriously, because we know that actually the good practice will support actually improved outcomes for people. But actually, as part of the self-evaluation that we undertake annually in terms of safeguard, and that's across all partners in the city, what we also do is ask that all partners, across health partners and statutory partners, are also undertaking and leading trauma-informed practice within their organisation. So it's not something that's sitting here strategically, very much as a delivery outcome and output for organisations in the city. And it's something that I will take back actually to our safeguarding board actually on Friday, just to reinforce and emphasise the need for that to happen, because I'm a very great believer is if you have really good trauma-informed practice at practitioner level, that could actually avoid re-traumatising people, and actually the circumstances that you describe, with that. So I just wanted to say that today, and really what's really helpful, I think, that we've got in the city is actually a real commitment to working together to improve outcomes and have joined up offer We recently had 2 LGP reviews on which we're going to bring these together, put them into an action plan and brief members on. But one of the key things that helps us to go and do is get to exactly the point that Councillor Milson talked about, was how do we make sure that people are not left behind, that actually people are not left trying to get the support that they need, and actually getting the rights, you know, and helping people to recover sometimes at the most vulnerable points in their life. And if I actually make a link to safeguarding, is sometimes in the absence of that, that's the reason why we end up getting ourselves to safeguarding, because ultimately we cannot say no to safeguarding. So for me, you know, the question is always about prevention, prevention, prevention. And the more that we can do that, we'll get better outcomes for people.
Thank you. If there are no further questions, I will refer members to the recommendations that are on page 96. So basically, most of the recommendation is just to allocate. Sorry, is there someone else?
I shall answer Councillor McLean's question around the event.
Oh yeah, sorry.
Just very quickly, it's the co-production and consultations that we're starting for the next step of the strategy. So this strategy at the moment runs up until 2026. And we're starting the engagement moving forwards to we'll have a good co-production and co-design approach to this. We need to start quite early.
Apologies, Councillor McLean. So the recommendations are on page 96. There are 4. They are mostly to reallocate the kind of oversight of the themes to different bodies or committees, except for the first one. So the first recommendation is to note the progress to date at Appendix 1 and request an update on an annual basis, with the next expected in September 2025. And on this one, we will also note Councillor Milson's comments, approved that responsibility for oversight of themes 1, 3 and 4 of the strategy are overseen by the Mental Health, Learning Disability, Dementia and Autism Delivery Group, of which this is yet another one I'm on, with also the note that for theme 3, if there is anything that is health related, it will also be kind of noted or endorsed or taken to health scrutiny, if that is okay, as I think it makes perfect sense. Number 3, approve that for theme 4, regular updates are provided to Health Scrutiny Committee and Adult Health and Social Care Policy Committee as an assurance of effective and good quality care and treatment services in Sheffield. And number 4, approve that the responsibility for oversight of theme 2 will transfer, along with wider responsibility for the emotional health and well-being and mental health of babies, children and young people aged 0 to 18 and care leavers aged 18 to 25 from the Sheffield Mental Health, Learning Disability, Dementia and Autism Delivery Group to Sheffield Children and Young People Delivery Group. So this is really important because it's been an all age and we're trying to be more effective by having a dedicated body for it. Okay. Are members happy to agree on those? So I can say that the recommendations on page 96 are resolved unanimously. And we move on to item 12, which is on page 119 of the pack, and this is the equipment, adapted housing and tech-enabled care. We have Kelly and Martin presenting.
Good morning. Just to introduce myself, and had a little bit of confusion to today's meeting. I've recently changed my surname, so I will update. I'm Kelly Kafarski, and I'm the Assistant Director for Living and Ageing Well Short-Term Services. And I'll just introduce you to my colleague.
Hi everybody, I'm Martin Smith. I'm the Assistant Director of Transformation and Delivery. I've got a joint role between the NHS ICB, South Yorkshire and Sheffield Council.
Okay, so just an oversight of the report that we provided delivers updates regarding the occupational therapy service, adapted housing, the integrated community equipment loan service, citywide care alarms and our tech-enabled care offer. The report sets out the position and progress with regards to each of those service areas. We are also going to discuss today some of the commissioning arrangements and options for the community equipment store with a focus on improving outcomes and delivering best value for money. And we're also going to provide you with the updates and with regards to citywide care alarms, particularly around the move from analogue to digital and the impact that this does have upon charging, and our proposal to undertake some engagement with the people of Sheffield regarding the provision and charging of that service. So I'm going to hand over to Martin just to cover community equipment store.
Thank you. As Kay said, I'm going to cover briefly the ask in the paper just around community equipment store. And I thought I'd just give a quick summary. It's within the paper, but just to summarise, that it is a jointly funded service that meets a statutory requirement between ourselves and the NHS. Currently, it's 67% funded by the ICB, 33% by the council, so it's a jointly funded service. It supports all ages across Sheffield, provides aids and adaptations to people's homes, supports people to stay independent for longer, supports them coming out of hospital and does a lot of good work supporting our people. The existing contract that we currently have expires next year, so it's the end of September next year. And when we originally tendered it, there is the option of a 2-year extension built into that contract to take us to 2027. We've been looking as a joint group at what we do next, what our options are, how we tie it into our tech strategy, what we do around our outcomes and how we get better service improvements, and had a discussion with procurement about taking this forward. Their advice was it could take 12 to 18 months to re-procure it, and that in line with everything we've heard today and what we want to do, we want to consult with the people of Sheffield properly on this service. It's also vital for supporting people independently, supporting people at hospital, so we want to make sure it's a smooth transition. There's improvement work going on the existing contract through something called a joint efficiencies group, where we're looking at getting better efficiency out of the contract and supporting the delivery and improved outcomes for people who are receiving the service. So the ask in this paper is we'd like to take up the option of that extension that's allowable for 18 months to allow us to build in some of the work that's recently been published by ADAS on a review of equipment services, look at best practice and look at our options for maybe jointly doing a service across different areas. But our proposal is to bring back a proposal paper in March to the committee to say, following our consultation and following the work we've done, we'd like to take this procurement option forward. The ask is around using an 18-month extension on the existing contract. Thank you.
Okay, so I'll just move us on to a number of updates. So the first one is with regards to Disabled Facilities Grant. So over the last 12 months, just looking at the activity, we have approved 365 adaptation grants, and we've also delivered 735 adaptations. We have undertaken quite a significant amount of work in this particular area, and we can see that we're already starting to see an improvement in our financial position. That really does lead back to the development of practice within the service, putting really clear guidance in place linked back to the national policy and guidance, and also a robust approach towards and fair approach towards means testing, which is something that we've implemented. So the budget will be fully committed. We are aware that there are some delays in the completions of work at the moment, but we are working with colleagues across the city to look at developing a rapid improvement plan, which will improve the delivery of the adaptations for people in Sheffield. We've also implemented our standard operating process and formalised our discretionary funding arrangements, and we're also working with our colleagues across in housing to look at our discretionary funding arrangements for the private housing sector, which will come to committee next year. So of course we'll be speaking to you about that nearer the time. Our principal OT, Amanda Greenhall, who's joined us recently, is leading a working group with people with disabilities and carers, and this will ensure that we've got a really person-centred, personalised and an approach that really does ensure that we're promoting independence with regards to adaptations and occupational therapy. With regards to the occupational therapy service itself, it's a really positive picture, and I noted that the update given in the previous report suggested that we've got a waiting list of 900 and What I can confirm is that is a change in picture, and what's really helpful is that we've now got a live dashboard, so I can confirm that actually today we've got a waiting list of 825. So we're able to really use that data and information to really look at how we deliver the services across the city. It helps us to really look at our own performance, understand our demand, and really flex that provision across where needed. One of the things that we've done which will help drive forward the improvements around our delivery of occupational therapy is that we've set up a clinic that will launch it actually launches a soft launch initially, but then we would like to welcome councillors that might be interested to a more formal launch of that clinic at the Manor in October. Various things planned around trusted assessors development and our focus on the workforce to make sure that they're really confident in their practice, and that's really starting to shine through in some of the outcomes that we're supporting people to achieve. With regards to the medical alert that's documented in the report, some great progress has been made there as well. So we've actually undertaken 756 risk assessments to date. We've got 72 remaining, which means that actually, based off the back of the alert, we are more confident that people remain safe with the identified piece of equipment that had been escalated as a risk to individuals across Sheffield. We're working with our colleagues in ICB and Joint Efficiencies Group to be able to provide updates about at a system level, not just with regards to the council. Tech-enabled care. What we're doing at the moment is really trying to bring strategy and operational together. So we want to really be able to bring back to the next committee meeting some of the outcomes that we've seen through some of the tests of change that we've implemented. So we've had 160 people that have taken part in both our house and Anthropos systems test. And we'll bring that information back to the next group. But that's really starting to feed into some of the evaluation work that we are undertaking, and also will help to shape our future commissioning strategy for tech-enabled care. We have been selected as well by Oxford University to be part of an evaluation around tech-enabled care, which is really positive for the city. Just going to move us across next to citywide care alarms, and just to set out that this service is very much at this point in time, it's quite a traditional service, and we've spent a lot of time over the last 18 months really moving this service from analogue to digital to be able to make sure that we keep people safe across the city. We've got quite a significant number of customers into this service, over 8,000 people supported to remain safe at home. So funding within to this service is provided in partnership with Health, and we've developed pathways that enable us to avoid ambulance call-outs. We support people that might have experienced a fall that traditionally would have been in receipt of a paramedic arriving at their home. So at the moment, the additional funding that comes into that service is around £320,000. There is some ongoing discussion at the minute with regards to attracting a further £75,000 into the service that could help us to extend this scheme into care homes, which is something that we're really keen to do. But just to highlight actually the impact of the delivery of the new pathway is just to set out that the estimated cost savings associated with the avoidance of ambulance call-outs currently stands at around £895,000 to the NHS, which is really significant and results in 276 calls being prevented. So, with regards to the citywide care alarm service itself, there has been no increase to the cost of that service for people in Sheffield since 2015. So that's a period of 9 years where we've not increased the cost to the customer, but this does have a really it's having an impact on our inflation costs within the service and our ability to be able to deliver that service in a sustainable way. So we are in a position where we've got to switch from digital, from analogue to digital, and the new equipment does require a SIM card within it. The SIM card by default does come with an additional cost. And at the moment, historically, we have been moving people across to the new service, but unfortunately, we've not been in a position to be able to look at that cost being passed on to the customer at this point in time. So there's been lots of work that's been undertaken with regards to understanding the costs that we are passing across to customers at the minute. So it currently works out at £21.42, and that's per month, and that's for our standard analogue equipment. However, the digital costs do come in at £30.39. So the proposal is that we would charge that additional cost directly to the customer, we were not proposing that we would backdate that cost in any way, but we are asking really that, you know, moving forward, we do need to start to reflect the cost for the service that we are delivering. I would just set out that the service has historically had an overspend. So the previous financial year, it came in at 504,000. This year, we're forecasting a £574,000 overspend, and it is a continued pressure. Some of the work that we have undertaken, though, is identifying some additional capital funding, which will help to offset some of that. So we're already forecasting that we can draw down around £450,000, which will help that position. However, we really need to make sure that this service is sustainable, but we also need to make sure that people remain safe and that the service does remain affordable. So I'm very, very conscious of that fact. We are also setting out that we undertake again a wider piece of engagement and consultation with people in Sheffield, and we also look across the country as well at learning from other areas that have been in a very similar position with regards to the delivery of this service. So what we'd like to do is really take on board a more wider review of our charging policy and think about how you know, we could look at our longer term charging model, taking into consideration, as I've said, the affordability and sustainability of the service.
Great, thank you so much. I'm so glad I asked that question, how much do we save the NHS, that you were able to get the data on that, because it just puts it in context, doesn't it, and how much, when you do prevention, you know, when we talk about prevention, we're doing the right thing because we're keeping people at home and safe and well, but at the same time, you know, the other side of the coin is that
it's the time saved that's key.
Yeah. I have Councillor Fox who wanted to go. I have a question as well. Actually, do you mind if I ask my question so I don't forget? In terms of the private housing and, you know, other social providers, I mean, the kind of collaboration with housing in general cannot come soon enough because it's a real kind of a weak link, I think, in the system. But are there any plans to do anything for people who might be in social housing with other providers or in their own home, private home, they need adaptations, but that don't have English as a first language? I'm saying this because I've done quite a lot of casework in my ward where we have elderly people, you know, they've been in the country forever, but their English is not good enough for them to have a conversation on the phone or to, you know, to be able to use digital means to report things, and they need an interpreter. Is there anything built in the system so that we do not let those people down?
Yeah, so quite excitingly, we've just been given the go-ahead for a pilot, so this is very new news, and the system's called Magic Notes. It's an AI system. And it provides us with the opportunity to work with individuals in their home, and it helps us to transcribe and translate the conversation that we have with the person in their own home, in their own language, and it translates it and also enables us to populate the assessment. So the two areas that have been selected for the pilot are actually occupational therapy and our first contact service. That system, I'll get the confirmation and we'll bring something back to the next committee about just the number of languages that it is able to transcribe and translate. But we've seen really positive outcomes of that in other areas that have been testing out that system. So I think that's one thing. And I think also, I completely agree that I think the work that we're doing with housing is very much needed. And we are being, you know, really you know, quite firm with the fact that we can also see there are a number of areas that which we think as occupational therapy we can work with housing, advise around some of the maybe, you know, updates around policy, ways that we're working, and there's certainly some opportunities for us to reduce the times in which it's taking people to perhaps be rehoused for suitable properties with adaptations, or alternatively to adapt their own individual properties, whether it's housing or their own personal property.
Councillor Fox.
Thanks, Chair. And thanks for the report. I really did enjoy reading the report. But what did come to me while I'm doing a piece of casework for someone who has to take really hot baths for muscular and skeletal issues that they deal with, it came to me that when we were talking about risk assessments and these new assessors and the aids and adaptations, is that just recently the government, previously the opposition released a report saying that if we took away the winter fuel pay amounts, 4,000 pensioners would die, and then somehow we decide that they're going to do that. Well, okay, get your head around that one if you can. Would we in our assessors, and also in aids and adaptations, be able in some of that to provide extra insulation? Because I understand the issue of giving opportunity to live back in their own homes, and then we take the money off of that. Anyway, again, that's a different argument. Would our new assessors and internally be trained to look into that, and also would insulation or that kind of help and adaptations be offered? I just want, and my final question probably to the Executive Director is, have we seen any of the government's impact assessment on that decision, or are they still holding it very close to the chest and not even shared it with local authorities as yet? Thanks, Chair.
Can I just pick up the first part? Is that okay? So first of all, what I would say is that that's one of the real drivers as well for us really getting to grips with the DFG budget and making sure that actually we've got that really close hold on that budget, because actually what it delivers is if we can get to a position where we are able to meet our statutory requirements with that budget around adaptations, then actually what it does deliver us with is an opportunity to use what's remaining in a really creative way. So in other areas we can use that for things like warm home grants, we can use it to replace boilers. So there are other options of how that grant can be used. So I think that's the first point. And I think the other thing as well would just be to say, and I'm just going to look at my colleagues to the left of the room, that the guidance has been updated recently, and we can take into consideration things like air conditioning and heating as part of any adaptation. So it has been updated. However, it does still mean that they would need to be eligible for the grant with regards to the rest of the adaptations. It wouldn't just be about insulation and heating.
With regards to the other question to the Executive Director, I will, if you don't mind, I will defer that, because I feel it's like a political question and it's putting the... I don't think the information is not relevant to this, but it's not been, I don't think the kind of impact has been shared yet with local authorities, as far as I'm aware. And anyway, there's no one, I don't want to put officers on the spot for things that they may or may not be able to answer. But obviously there will be repercussions, and I'm sure that we will do analysis of what the impact is. I think Councillor Dwyer.
Yeah, thank you. And the point about the NHS, I'm glad you asked, because that saving demonstrates the issues that 14 years of cuts to non-statutory services in local authorities has caused increased pressures on the NHS. And I suppose the question was, is there any way of recouping money that we're saving the NHS to fill current gaps in local authorities? And then the question about AI, and it's interesting that it's being implemented, but obviously one of the issues with it is what training, because they're large language models, they're not thinking machines, and what languages are they being trained on, and how is that training done, and is it going to be like Google Translate, very poor and not up to scratch for using for translation? And then it's mindful of the earlier reports we had with equality and inclusion, and are we making sure that we're not introducing technologies that take away from people actually being able to access care in an inclusive way?
Okay, so just to answer your first point, I think that's obviously a reason why we are working very closely together. We absolutely are really confident in our ability to deliver savings to the NHS, and so therefore it's important that where there are opportunities to bring some of that money into social care that can help us to deliver those services to improve outcomes for people, we're absolutely working together to look at doing that. With regards to the Magic Notes system, the system that we have got for a pilot is just for a period of 12 weeks, and it's for 20 staff. What I can tell you is the accuracy rate of that AI technology is 98%, which is significantly more than some of our other AI platforms that we've got access to, and it is specifically designed for social care. And I've also just tested it out myself. So I've spent some time, you know, talking about as if I'd just been discharged from hospital, and it was really good. It was very positive, and we're really excited to test that out. But also, what I was going to suggest was, when we've got to the end of the period of pilot, if you was interested particularly in that, then I'm quite happy to share with you any learning from that.
Would be amazing. Can you be very quick, because we may have to extend the meeting for the first time ever.
Okay, thank you. I mean, I just wanted to heap praise on for the reductions in waiting, which those numbers are amazing. If people haven't drunk them in, do, because that's really, really impressive. I wanted to just mention about citywide alarms. I can't find, unfortunately, the correspondence. I was looking for it. I've had people writing to me saying that they receive a pile of letters from citywide care alarms, and they don't understand why, and there is a cost to that. And if we're putting the cost up to customers, can we look into whether the amount of correspondence that takes place is actually necessary, and see if that can be cut down as a cost? I know it's only, you know, £1 a month, whatever, but that does add up. So.
Just to let you know, we've actually undertaken a workshop on the as-is process and the future process of the system, and I completely agree that there's lots of opportunities there to create efficiencies in the service, but also it's about releasing staff time, so they're really focusing on the things that are important to the service, and paper-based and letters is certainly something that's high on the agenda from the workshops that we've undertaken, so we'll be taking some learning from that and putting together an action plan. Thank you.
Thank you. I am going to draw your attention to page 120 and 121. There are 8 recommendations. The first one is to approve an extension to the integrated equipment loan service of 18 months consultation and engagement will take place regards future of the e-cells, which is the integrated equipment loan services, contract commencing on November 2024 to enable a recommendation to be proposed to committee in March 2025, which is what Martin talked about. Then number 2 is notes, consultation and engagement will take place between September 24 and January 25 regards the disabled facility grant and discretionary funding policy to enable a recommendation to be proposed at committee in March 2025. Notes the update on the delivery of the Council Occupational Therapists and Citywide Care Alarm Services. Notes progress in delivering technology-enabled care ambitions, including the financial impact of digital switchover. Approved charging the amount reflecting of the additional digital cost where the digital switchover is applied to customer, so that Sheffield City Council is not at a financial loss. Notes engagement will take place between October 2024 and February 2025 to propose increase in citywide care alarm charges to achieve an affordable service. The outcome of the engagement will be provided to committee in March 25. Approves an annual review of the citywide care alarms charging policy to ensure sustainability of the service. And finally, number 8, requests that the Strategic Director of Adult Care and Wellbeing provides the committee with updates on progress and outcomes in relation to performance and financial spend on a 6-monthly basis. So that needs to go in the, just as a reminder, in the work programme. Members happy with those recommendations? So I will take that as assent, and I will say the recommendations are resolved unanimously. And we're going to, thank you so much, both of you, and we're going to item 13. Are we doing item 13 and 14 together? Are we doing them separately? Are we doing them together? Could we do them together? We have 11 minutes.
Just take the recommendations.
So, sorry, officers, are we doing the reports like together? Yeah? So we're doing item 13 and 14 together, and there's a rush around against time to see if we can finish on time. I've never finished late, so there you are.
Good afternoon. I'm Jonathan McKenna-Moore. I'm the Service Manager for Business Planning and Governance.
Hi everybody, Liam Duggan, Assistant Director, Care Governance and Financial Inclusion in the Adult Care and Wellbeing Directorate.
Jane will be Assistant Director of Finance and the Deputy Section 151 Officer for the Council.
So, I'm going to give you a brief overview of the report, which is our quarterly report to update on the financial position, delivery of the recovery plan, and any updates on our financial governance. So, in the background section, 2.2, we provide a bit of context, including the last year's outturn at 3.1 million overspend, the 17 million underlying overspend that led to the need for the recovery plan, and analysis of the demand across the key areas over the last few years. And that shows that demand overall, as measured in the number of contacts we receive, has risen by almost 100%. At the same time as this, going back to 2017, we've been required to deliver an average of 22 million savings each year. So just to explain that, that's not to say that the budget hasn't increased in money terms. We've had small increases through social care precept. We've had some increases come through an adult social care grant, but those haven't been sufficient to meet the increase in cost we see each year. So that requires a saving each year. So given the context of 22 million savings, when we look at last year's outturn of 3 million, that's actually significant savings to get to that position. So going into section 2.3, that's the financial forecast at the close of Q1, and that is currently a forecast of 9 million overspend by the end of this financial year. Again, just to explain, we haven't gone from a 3 million overspend to a 9 million overspend, and we've seen a 6 million increase in costs over the first quarter. That's because income we had last year that was offsetting costs has been swallowed up by inflation. So it's not that suddenly costs have increased, it's just the allocation of income. Section 2.4 looks at the budget implementation plans for the year, which are forecast to deliver at 94%, and they are mainly based on income we receive and budget adjustments. So the majority of those are now closed as complete. We have a few outstanding ones that are action-based. So the optimised care work, which was described at the time as proportionate care, that work is starting this month, and the slippage on that is being offset by over-delivery on our contribution income. We've also seen an increase in demand for S2A beds, that's a somewhere else to assess beds, which is a discharge pathway from hospital. So that has created slippage on that saving, but we are putting in greater controls around that, and we've got a task and finish group around that, and we've already started to see that demand return to the levels we'd expect. And finally, there's been some slippage in the mental health reviews. So we've sort of extended our promoting independence approach, and from there we're building an enablement team as well going forward, so in order to address that demand. Section 2.5 looks in detail at the recovery plan, and we're forecasting a delivery of 80% there. Again, some extra income is mitigating some of the areas there. We are seeing slippage on the recovery plan, especially around some of the review-based savings and around the ones based on accommodation. So in response to that, we've agreed to put in a new project team in Adult Future Options, and they'll be helping around the cost of people coming through transitions and also supported living reviews. And we've also agreed a few posts, a couple of posts to lead on tech-enabled care in learning disability services, and to lead on the use of the Care Cubed software in negotiating non-framework rates. So funding for those posts has been agreed and they should be going to advert this week, so we should start to see that improvement come through. And in addition to that, we're expecting to see some new sites in the market come through by the end of the year for supported living and short breaks, so that should improve the options in the market. So section 2.6 just gives a bit more context on where we have the staffing overspend. So as was touched on in one of the previous papers, there's an overspend against the multi-agency safeguarding hub, and that's because that service has been developed over the course of the last year. Wasn't in time to build in budget for it this time last year, but we believe in that approach. We believe it's delivering what it needs to, so going forward we'll be proposing a permanent budget for that service. For short-term services, reporting an overspend of just under 2 million, and so a bit of background to that. In previous years, we reduced the cash limit budget going into there, but we had temporary grant budget offsetting those costs, so we were able to maintain the service. And referring back to table 1 of the report, over that period we've seen a 50% increase in hospital discharge, which directly relates to the demand to that service. So this year that temporary grant hasn't been available, so that has led to the overspend position. We are doing work around the proposals around citywide care alarms, which we've just heard about, and we're also conducting a service review in that area, which we'll be able to report on later this year. And then the last two sections, section 2.7 just goes over the new mitigations we've been pursuing in order to improve the forecast. I've touched on the ones that relate to additional posts already. We've also made sure that all our charges for income are up to date. And we're currently in the process of commissioning an external consultant to provide analysis of adult care to explore more opportunities for efficiencies. And then the last section, 2.8, just provides a note that we are conducting a review of our fairer contributions policy. So that is the policy that determines how contributions towards the cost of care are calculated. We're not expecting to see a radical change in policy because it's governed by a national framework and we benchmark against other local authorities, but we have had requests for more clarity in the process, especially around disability related expenditure and our appeals process, so we'll be reviewing the policy with that in mind. Conscious of time, so in terms of questions, obviously open to questions, but we do have an open offer to members for briefings, so it's an open offer for the committee.
Thank you. Do we need to extend? Can I, we may not use the whole half hour, but it's just so that officers don't feel rushed and we get a chance to ask questions if we need to. So we're extended by half an hour?
Yes, to start with, yeah, that's fine.
Thank you. Shall we go into the other? Thank you so much, Jonathan, for that report. And I think the narrative is so clear. So thank you very much. It was really kind of easy to understand each section. Very, very clear. Thank you very much. Jane, are you guiding us through the general one?
Sure, thank you. I'll just go through this sort of overall council context and not go into the adults social care sort of detail because Jonathan's obviously covered all that already. So the paper talks about the position at Q1, which is a 34.3 million overspend this year, which is 7% of our net revenue budget. The main drivers are increased service demands, rising costs and reduced funding. The areas that are driving the overspend are housing and homelessness, adults and children's social care, and SEN home to school transport. Inflation is a significant contributor, which has increased the overall cost base, and in some cases our service costs are rising above the rate of inflation. Funding levels have not kept pace with the rising costs, and it's created a significant gap. And the fact does remain that Sheffield has got 26% less, or £858 per household in real terms when compared to 2010-11. And this is well above the national average, which is about 18%, or £556 per dwelling. So this severe reduction has placed additional strain on our ability to deliver services. The Council has set aside reserves to manage the position associated with budget delivery and expect to draw from the reserve to manage this year's overspend alongside a specific provision to manage the housing benefit subsidy loss issue. So using reserves is a short-term solution and is not sustainable. It's a serious financial position, and our finance teams are working actively with officers across the Council to identify and implement immediate cost-saving measures. We're developing strategies to manage and mitigate demand pressures and making efforts to increase income wherever possible to address the areas of overspend. It's not unique to Sheffield. These issues are part of the broader trend affecting the entire public sector, and pressures are growing across the NHS, schools and higher education, which limit the potential for future government relief. Our key response as a council to these challenges is our Future Sheffield programme. The initiative is focused on transforming services to create a more sustainable and efficient operating model. Transformation is essential to ensure we can continue delivering statutory services while supporting city growth. Our efforts are being aligned with the broader strategic goals and will play a big part in our budget setting process later this year. Our medium-term financial strategy published in July identified a gap of £68.9 million over the next 4 years, with £31 million falling next year. Our focus is on long-term financial sustainability, which underscores the importance of the transformation efforts. We are taking immediate actions and engaging in longer-term efforts to address the challenges and collaborating across the Council with strategic initiatives under the Future Sheffield programme. So we are encouraging all departments to continue working closely with our finance teams to identify and contribute ideas for cost reduction, demand management and income generation. So the next update will be the Q2 paper, which will come to the Finance Committee in November and to all policy committees in December. As I said, I've not covered any of the adult social care stuff specifically because Jonathan's kind of picked a lot of that up in his paper. So happy to answer any further questions you've got on the overall Council's position.
Are there any questions on either of the papers? So I've got Councillor Milson and Councillor McLean first. Do you want to do both your questions?
Thank you, Chair. Thanks for the report. This is not my area of strength. Still don't understand it despite multiple briefings, but I do have a question about pooled budget. So discharge, somewhere else to assess, and equipment and adaptations, they're both funded from pooled budgets, as I understand. Is that right? And I just wondered what our NHS partner is doing to help mitigate where it's the responsibility for overspend falling equally or proportionately between the two bodies, local authority and NHS.
Thanks, Councillor Milson. So, yeah, we've got a series of working groups, meetings that exist, relationships that exist between ourselves and various health bodies. We've got a monthly joint efficiencies group, we've got a leadership meeting, we've got meetings that take place between the chief execs, the strategic director and the directors of finance. We've got a joint efficiencies group, joint efficiencies plan and several arrangements that take place to govern the use of the discharge grant which exists within the Better Care Fund. So there's a lot of partnership working to ensure that we're making the best efficiencies, making the best use of the Sheffield pound, but also to make sure that the various pieces of funding and temporary grant are used most appropriately and where they can make the biggest gains for the system.
Sorry, that didn't quite answer that. I'm just worried. I'm just thinking about the proportionality of where responsibility for overspend falls, and how, like, is it picked up proportionately to the amount that is pooled from each body? So we put a certain amount in, NHS put a certain amount in to those pooled Section 75 budgets, and is the responsibility for overspend also divided proportionately?
Yes, where there is a pooled budget in that regard, then the overspend is also pooled in accordance with those proportions. There's a lot of other activity that is funded together through the drawing down of different pieces of grant as well, which is why I was trying to... Yeah. But the direct answer to those pooled budgets is yes, that the proportionate split is carried.
Alexis.
It's a really good question, Councillor Milson. And one of the discussions I've had with health colleagues is that the council cannot accept a risk for discharge increases in spend. That's the crux of it. And so the task and finish group that is looking at somewhere to assess, which is one of the key financial risk areas, is being chaired by myself and my colleague in NHS, to go underneath what are the issues, what's this expenditure, and actually how do we make sure that we achieve best value together. And because ultimately, I've been very clear from our position, is that we can't accept the costs, essentially, of that. I think the other point to kind of raise within here is some of the funding behind discharge also has been provided through different grants. And one of the risks that we've raised previously with members is that some of these grants are non-recurring, and they do end come the 1st of April next year. And that is a risk because the NHS side of the discharge grants are recurring, the local authority are not. And it's an issue in which is, I'm raising that today as a risk, and it's something which we will continue to progress and thinking about what does that mean come 1st of April if these grants are not continued. Because I've also been very clear, we can't accept that risk.
I have Councillor McLean and Councillor Fox.
Thank you. Just looking at the Q1 monitoring report on page 186, the report acknowledges that beyond this financial year, it's the general acknowledgement that due to fiscal constraints, there will be little, if any, increase in public sector spending. And I just wondered what other things that could happen that might make things more improved position, I guess. And I just wondered what we think the effect of multi-year settlements would be, specifically for adult health and social care, if that would make a difference to the future outlook. Thank you.
From our perspective, a multi-year settlement would have a significant impact. If we look at the last couple of 3 years, we've had significant amount of grant coming in very late in the day, which has meant that we've made savings or committed to savings in some areas, which we've then able to bring grant through. The grant comes through, particularly the discharge grant, the MSIF has come through quite late with very tight grant restrictions. So we're looking at mobilising activity within quite a narrow focus to meet the grant conditions, and with very short timescales. And of course, trying to recruit at the moment is challenging, and when that recruitment has to be short term, it becomes almost impossible. So to put forward long-term plans where we're looking at mitigating long-term demand for adult social care, we really need longer-term funding settlements.
Just to conclude, I was just going to add to that, if you don't mind. Sorry, Alexis, for you coming in. Just to say, in terms of our medium-term financial plan as well, if we have only got, we only really have certainty of 1 year in terms of where we've got at the moment. If longer, term gives us better consistency and better ability to align our strategic plans to our medium-term financial analysis. So, again, along with your point, Liam, we're not having to quickly scale down and scale up teams and resources and services to just match the funding that we're currently given. We've got a broader planning horizon, just gives us that consistency and stability to be able to properly map our plans across, because really beyond a year, there is very little certainty that we do have. It's built a lot on assumptions, so it's really, really difficult for us to plan any further than that. And as Liam said, when we get funding given to us, towards the back end of the year, it's not always that helpful. Obviously, extra funding is always helpful, but it creates a lot of work, and that that instability and inconsistency is just really, really difficult to plan for. So yeah, I think that's one thing that we would welcome. I think we're not anticipating that there's going to be a huge amount of money that's going to flood into public sector, particularly to local government. But, you know, the consistency will offer us something in the short term. We're hoping as well there might be some, you know, more relaxed rules around some of the funding that we've got at the moment, some less restrictions in place, which again gives us a little bit more certainty to plan.
Thank you. Councillor Fox.
Thanks, Chair. And I sit on the Finance Committee, so I'm quite comfortable with some of these figures. When I say comfortable, I'm comfortable in knowing that they've been presented a couple of times. First of all, I have to say that I'm so elated after dealing with local authority budgets over 20 years that we are going to go to a priority-based budgeting scheme. I think that will give officers and members some comfort that we can prioritise where we need to go. My question, Chair, if I can, is how comfortable are officers that the recovery plan will hit its target? And I understand this is quarter one, and so in the finance world, this is quarter one, I get that, and it is a photograph in time. But how comfortable are we that we will hit the recovery plan target for this year? And as members to office, is there anything else that we can do to assist to make sure that we get to that target for the end of the year? Thanks, Chair.
Thank you. So the recovery plan is as a target of around £17 million. Some of that is well in hand, some of it is delivered, some of it is well on track. Other elements are slipping. The elements that are slipping are the kind of the long-term endeavours around accommodation with care and reducing the cost of long-term packages for people of a working age, people with learning disabilities. These are not quick fixes, not easy things to turn around in a short time scale. So we have adjusted our forecast that we're bringing to committee today to show the length of time that we think these things will take. The savings are deliverable. It's all about time scale. And where we are forecasting that things will slip beyond the end of this year, we're bringing forward additional proposals, additional short-term mitigations, which Jonathan touched on, which I think are in section 2.7 from memory, which we're looking to that will sort of mitigate that gap. We need to review the recovery plan. We need to ensure that the pressures that it's looking to mitigate. We established the underlying pressures of 17 million last November, and we need to review that one year on. Sort of sands have shifted beneath our feet in terms of the kind of the pressures that are exerting on our social care. So when we come back in November, we'll have refreshed those underlying pressures, and we'll be taking another look at that recovery plan to make sure that it's properly aligned to the pressures that are existing at the end of 2024.
Thank you so much, and thank you for the reports. Oh, sorry.
Sorry, Chair, can I just would like to come in as well to address your point on priority-based budgeting. I think it is long needed. So finance teams are working with services, and we're going through a big process at the moment where we're looking at individual budget lines, looking how that aligns specific to our organisational priorities and the council plan, alignment to council plan, effectiveness of delivery, and what the impact of non-delivery would be on people of Sheffield, as well as financial effectiveness. So we're scoring all of our individual budget lines along those criteria, and that will enable us to actually, when we talk about priority-based budgeting, let's be right, the gap that we've got at the moment is so significant in year and next year as well. We need to talk about deprioritising. And that's what we really mean when we say priority-based budgeting. It's not about giving more services more money, because there isn't any more money. It's about having an appropriate way of being able to, and a framework to work with, to be able to develop that better. And it will be challenging. There's a lot of work to be going forward. And we are developing savings proposals at the moment, but we're also looking at pressures in the same way. They are investment opportunities for the council, and we need to be making those decisions along that same criteria as well. So yeah, it will be a different way of doing it this year, but I think we do really need to have a good look at services if we're going to get anywhere near back the 34 million that we're away this year and the 30 million that we're off for next year as well.
Thank you, and can I echo that? I'm part of some of the working groups that are behind all of this, and it does make a lot of sense. And thank you so much, for highlighting so well what our challenges are. I don't think that we've ever delivered so well on our recovery plans like we are at the moment, and the challenges that we are like the pressures that are increasing. So it's not that people are not working hard, it's not that we're not delivering against our targets, it's that the demand is there and the funding from central government is just not coming through. As you've all said, we have this massive gap from what we used to get in 2010 and what we get in real term money today. So, unless we have magic, some kind of surprise in how much funding local authorities will get, we have to work with what we have or we don't have, really. So I thank you to everybody for all the work, and for colleagues that have attended the finance workshops put on specifically for adult health and social care. So I have two sets of recommendations. The first ones are for the item 13, so it's the quarterly finance and governance update. They are on page 154, and they are as follow. We note the update on forecast upturn for 24-25 financial year. Note the update on planned savings. No, I'm reading the wrong ones. These are the ones for the second, sorry. So the one for item 13. Are those the right one? There they are. Okay. Note the update on staffing budget and underlying risk management decision. And number 4, note the update on fair contribution policy. Are members happy with those recommendations? I take that as agreed, and so the recommendations are resolved unanimously. And then we go to the recommendation for item 14, which are on page... Interesting. Oh, here. They are on page 179. There's only one, and it's for us to note the update information on 2024-25 revenue budget upturn as described in this report, including the detailed committee budget monitoring information and management action provided. Are we noting this recommendation? We are. So the recommendation is resolved unanimously. Okay, and I only have to say that next meeting is sometime in October. When?
Is it the end? 30th.
On the 30th of October, and I close the meeting at this point. Thank you very much.